get started, I want to do a special salute and thank you to all those in service during COVID-19, our doctors, our nurses, our police, our fire, all first responders, folks at the hospitals risking their lives to help us combat this. And then folks, our sanitation workers who are out there every day. As you see, last night we had a huge storm come through the city, and you saw the forestry team out, the sanitation team out, you saw the street team out, you saw everybody kind of rallying together as a staff, cleaning up the city and making sure that we're making sure the city is still taken care of. And this quote I came across, I felt like was appropriate, that some jobs can't be done from home. Many of us have the privilege of being able to work from home or be able to stay at home during this time, but our first responders and folks like sanitation don't have that luxury. So when you see them out, give them a nice salute, nice hand wave, and thank them for what they're doing to keep our community safe and clean. So with that, we're going to jump right into just some reminders. You know, the governor ordered a stay-at-home, ordered for us to flatten the curve and keep from the spread of this coronavirus in our community. And so we wanted to give you a couple reminders about how to stay safe during this time. You know, wash your hands often, at least 20 seconds with soap. Avoid close contact and stay home as much as possible. If it's essential, you know, groceries and things like that, we understand. I'll talk a little bit more if you're a senior or someone with a disability who needs food delivered to them. We're helping out with that as a community. Cover your nose and mouth. You know, the mask. The governor has recommended wearing masks. So, you know, there's a lot of DIY videos online on how to make your own mask. So make sure you're doing that. Cover your cough and sneezes with your elbow, and keep everything clean and disinfected on a regular basis. But the true expert on all this is our health commissioner, Dave Covell. So Dave, thank you for joining us. And I'm so excited to be able to talk with you about just some tips on how to manage through this COVID-19. We're going to talk about the number of cases and how we plan to keep up with that. And but first off, I just want to thank you for being here. And Dave, if you don't mind just introducing yourself, give us a little bit of your background.
Sure. Yeah, as the mayor said, I'm Dave Covell. I'm the health commissioner here at Lorain County Public Health. I've had over 30 years in public health experience, and I've been through some lighter ones of these, some ones that weren't as severe as this, like H1N1, and when we looked at SARS and MERS and even Ebola and some other things. But this is clearly the pandemic that we were worried about for a long time.
Mm-hmm. So Dave, first off, you've all done a great job at communicating and making sure that the community is aware of how to respond and react to this crisis. Can you speak to the number of cases we have countywide, and then we'll dive into Illyria's specific cases.
So every day at 2 o'clock, we update cases, and we're at 119, but we'll have more today. And so at 2 o'clock, you can check LorainCountyHealth.com, and you can get an update of those cases. And there's some general information on there. It also has the number of people who have recovered, which we've had some that have recovered. And unfortunately, we have had some deaths, and so it has the numbers there too. And so you can do that at 2 o'clock every day, LorainCountyHealth.com, and get that update.
And so Dave, when we talked, and Dave and I are in frequent communication, probably text every other day. And, you know, part of what you've advised, others have advised as well, is just to be cautious about the number sharing. And there was a number of reasons why. And I'd like for you to touch on them as the expert, just in terms of the testing, that we, you know, the people who are tested, aren't tested, the asymptomatic. If you could kind of speak to why there's challenges with the numbers that we're currently sharing and why we've been somewhat hesitant on how we share those as a geography.
So the reason I contact the mayors and police and fire is because, of course, you know, those emergency responders, they need to be safe. They need to know what's going on in their community in terms of positive cases. But again, the real piece that I want to stress here, if you have 2 cases in your community, if you have 15 or 20 cases in your community, those are only the confirmed cases. And so remember that most of the people who get tested are either healthcare workers, or they're an older adult or someone with immune compromise scenario where they have to go to the hospital. And so with limited testing, those are the folks who are testing. And people who we are not testing, so someone who maybe has light symptoms or begins with light symptoms and is at home, we're assuming they have it, and we're asking them to stay home. And so when they're screened at the hospital or at the testing site, they're going to, if they have mild symptoms with no other health condition, they're going to be asked to go home, assume they have it, and try not to spread it to their family or to the rest of the community. So you can imagine that even if you have 10 cases, you may have 10 times that many cases in your community. And so and that's when people talk about community spread. That's what they're talking about. It's really asymptomatic people or people with light symptoms that are the ones who are going to spread this, which is why we really need to stay at home. Okay, this stay at home order is really working here in Ohio. You can see that in New York, it had already hit faster than it did here. And so we both put our stay-at-home orders around the same time, but it was already spreading in New York. And again, we know they had 731 deaths on Monday in one day. So it's important to remember, we want to try to shelter Ohioans from overwhelming our healthcare facilities. And so thinking that just because maybe here in Elyria you have 15 cases or whatever, that you only have that many cases, that's absolutely not the case. We know there are people with the community in the community that have this.
Yep. And that's been the challenge for me. I try to keep up with the feedback people are giving, whether it's on Facebook or other channels, and folks want to know the number. And I'm like, when we had 2 and 3 cases, and I'm like, well, we may have 2 or 3 confirmed cases, but if people have been sick with symptoms, we've been telling them just stay home and recover. If it's not emergency, if you don't feel like it's life-threatening, just stay home, quarantine, isolate, and recover. So they wouldn't be counted in that boat. Folks who are asymptomatic wouldn't be counted in that boat. And so we didn't want people to just like, oh, there's only 2 cases, we're fine, let's go out and party, let's go out and do it. It's like, no, that's not how this thing works. But if you don't mind, if you could share just where we are in terms of confirmed cases in Elyria. I know, unfortunately, we had our first fatality this past weekend. But the one reason I thought, we might share like on a weekly basis these cases, because I do want people to see how when we peak and then when we start to decline, so they can start to see that the number of cases are declining, and so that people will know that the stay at home is working.
Yeah, so it's important to remember that those numbers are better at the state level and at the county level than at the city level, because of course, each city doesn't have a high enough number of confirmed cases to really look at that too closely. But so like an example here in Elyria, where you have 18 right now, you may end up with 20 by tomorrow and 30 by the next day. So as I give you those updates, I think you want to be clear that just because you may have 18 confirmed, that doesn't mean you only have 18 people.
Yes.
And I think the more importantly than that, when people are at home, they really need to understand how to protect their families so that they don't spread it. And so I just want to go over a little bit of what we're doing behind the scenes so you understand that. So whenever someone gets confirmed, we're contacting everyone who's a close contact around them, and then we are quarantining those folks so it doesn't spread. So that's happening behind the scenes to slow it down. And we actually just put a video up on our website that you can link to that describes what case traceback looks like and what we're doing with it, so that people can understand that part. The bigger concern, again, even if you think about the population of Elyria, even if you're talking about 18 cases or 20, or even if in a week you have 25, that doesn't sound like a big number. Well, the problem is, we know that community spread's going on, and there's going to be some numbers coming out from the Ohio Department of Health that's going to talk about 10%, 10% of the population. So now you start doing the numbers of 10% of the population, you're talking more like 6,000 people in Elyria. Now, we don't know that for a fact yet, and because testing is limited, we're not going to know for sure, but we know that there's certainly more than, again, 10, 20, or whatever. Yep. And so it's really important, especially, and I know you and I have talked a lot about this, when you share numbers, make sure that we're continuing to emphasize, hey, we may only have this many confirmed because they happen to work in the medical community, they're a first responder, or maybe they're an older adult or whatever. But it's really important to stress with everybody else, do your part. Try not to let it spread.
Yeah, no, thank you for that, Dave. I think that you hit the nail right on the head in terms of all of us have a role to play in this, and I've seen a lot of great like visuals online just about staying at home right now is the safest thing to do. Like be a hero and stay home, and who knew that by staying home you would be serving the community and helping the community out. But can you speak a little bit about the asymptomatic side of things? How, and I've shared that with the staff here is like I could have it right now and not know it, and how important it is to have perspective on how this virus works.
So think about this for a minute. It's allergy season right now, right? And so let's say you're asymptomatic, you have COVID, but you're really not showing any symptoms. But you all of a sudden sneeze or cough because of an allergy or whatever. It's something in my family, whenever, I don't know why this is, but all my brothers and sisters, when the sun hits us right in the face, we sneeze. I have no idea why. It's just some kind of reaction. So I can spread that. Even though I'm not sneezing or coughing because of COVID, because it's not really affecting me too badly, I could still spread that. And so that's really where these masks are coming in, where the CDC has kind of changed and said, well, why don't we all try to wear masks when we go to the grocery store or when we go to the CVS or wherever we might be going? Because the cloth mask doesn't protect you from other people. It protects other people from you. So if you happen to, and they're even talking about if you're really close to someone and breathed on them, you might be able to even spread it. Again, this is about keep 6 feet away. And if you have a mask on and you did happen to cough, it's even better than coughing into your elbow, right? We always say, cough like this. Well, a mask does that even better than your sleeve does. And so that's really the idea behind that. My wife actually wore one yesterday for the first time. She went out to Giant Eagle to go shopping. And she said it was a little hot, and so she was a little bothered. But so she's learning how to deal with it. Again, the other really important.
Dave, I think you bring up something right there, just in terms of all of us are learning how to get comfortable in this new space. Like, right. And I think some folks are putting a lot of pressure on themselves to figure it out right now, and we're all trying to figure it out. Like, as you can see, nationally we didn't have it figured out. Locally, we're figuring it out, and individually, we're figuring out, all right, which mask fits do I like best? I've been watching a lot of DIY videos, people making their own mask, and for all those, I know Derek Firestone, he's a big Marvel and superhero guy. Here's your chance. Those folks who want to be superheroes, here's your chance. Wear your mask every day. Real heroes wear masks, so here's your chance. But I think that it's just important for us all to know that we're all figuring this out,
Right. And so here's the other place where a mask really could help. Okay. And so let's say one of your loved ones, your daughter, your son, your wife, your husband, whoever that might be that you're living with, right, happens to start showing some symptoms. Now, maybe they're not bad enough to go get tested and you don't know for sure they have COVID. But what you should be thinking about is, how am I going to isolate at home, right? Can they stay in their own room? Can people have separate rooms and separate bathrooms? Can you make sure that when they use the bathroom, they're not using a common towel, right? They've got their own thing and you've got yours, right? And more importantly, when they come out of their room, they should be wearing a mask so that they don't cough on anybody else in the family. And we take our families for granted. Let's be honest. I mean, my wife would tell you that. But our idea of let's not spread it in our family. Because again, your family member also might be someone who's an essential service, so who's out there in the police or fire or something like that. And so again, you don't want to give it to them because they need to go to work. And so again, that's a great place for one of those cloth masks to be used at home when someone does start showing, even if they're light symptoms, just to kind of help.
Well, you brought up a great point, and in terms of family, and I definitely want to say hi to my wife, Helena, Octavia, Sophia, and Eliza. I want to say hi to them. And so our middle child has asthma. And so, we've been very cautious about how to manage and make sure that she's staying protected through that. So what you just brought up, something I'm going to make sure to take back home and talk to my wife about it, just how are we even within our house protecting her. And I know you've seen a lot of the research that's been coming out about African Americans being disproportionately affected by this just due to chronic health that has been impacting the African American community around asthma, high blood pressure, diabetes, these other things that already compromise our immune system that make us more susceptible to having more complications. Can you speak to a little bit of that, of just not only specific to African Americans, but people who have these compromised immune systems.
Yeah, you know, we talk a lot about older adults, okay? And the reason we talk about that is older adults, as you get older, your immune system gets less strong, right? And so that's why we talk about older adults. But if you think about anybody with asthma or COPD or even diabetes or some of these other underlying health conditions, maybe you know somebody who's going through cancer treatment right now or something like that. Those folks are really the ones we're trying to protect, right? I have an 87-year-old mother who lives with my sister, and so I haven't seen my sister in a while other than in video. And again, the idea is to how do we keep it away from those folks? And so we talk about older adults, but it's important to remember that you can be any age with some kind of underlying health condition, whether that's asthma or something, and it can be an issue.
Yep.
In terms of African American statistics right now, because our numbers are not huge at the county level, it's hard to really look at that. But at the state level, you're starting to see that the fatality numbers are about the same as the same percentage, but the number of people that are coming down with it is disproportionate at the moment. And some of that is what you said, where there's some other access to care issues and other issues in our communities that have been disproportionate. And so you can see how that's affecting folks now. That's really a lot more in other states too. In Chicago and in New York, they've seen a lot of this. And again, some of it is that ability to get the regular health care that we want all the time people to get, so that they stay healthy on a regular basis. And so that has been disproportionate. And right now in Lorain County, that hasn't shown to be the case, but that's mostly because our numbers, it takes a lot of numbers in order to kind of figure out what that looks like.
Yeah, can you speak? So we got some questions coming in from Facebook, but so we'll take a couple of those now. But as you were speaking, I was just thinking about how you mentioned some of these, chronic public health issues that we haven't been able to address as society, or now we're seeing the result of that. Often when we're having conversations about access to care and transportation and having a primary care physician, all these things, it's like, oh yeah, I'll get to it. It's not that high of a priority. Now, moments like this, we realize that how important that is. And so I'm hoping that, we have the sort of community change out of this. Like this wakes us up to real change that we need to have in the community. But Ren, you're going to read off some questions we got coming in from Facebook.
Absolutely. So the first question that we have is from Tiffany Reedy, and she's asking, are there certain materials that are better to use for making masks as you're out in public?
Ohio for number accessible in the 50s.
Okay, Dave, you got that one?
Okay, sure. So in terms of masks, it's two things that are important. Remember, you want to wash your mask, right? So you wear it out in public for the day. So you need to be washable. So people have talked about using coffee filters and other things inside the cloth. Well, the problem with that is as soon as you wash it, it's going to fall apart. So, really the best thing I would suggest, there are some really good instructions on how to do layers of cloth. In other words, folding it over and folding it over and folding it over. And those layers will help anything from getting out of there, and it'll still be washable. So that's really the key. I think those are the two pieces, because you don't want to have a mask that you can never wash without it falling apart. Now, you could hand wash it, and so you can get away with that. But again, if you can make it durable and have enough material, and again, the material's really kind of a t-shirt cotton material folded over and over is good, but there are some more thin materials that are obviously, like using some kind of nylons or something like that obviously is not going to stop anything. It's really about, can you get a material that is thick enough that if you folded it over a couple times, it would be good, and then also be durable.
That's awesome. That's awesome. All right, Ren, you got another one?
We have a question that came in from someone named Joshua on Facebook, asking if COVID and the pandemic is looking to continue, and this is something we may be looking at for a while. Can you speak a little bit to the plan from Lorain County Public Health and what people can expect if we see this extend beyond the stay-at-home order right now?
Yeah, so a couple things. One, this is only step one for the health department, unfortunately for us. So we've been in incident command here for a while because this has been going on since the end of January for us, because we had people coming back from China that we had to quarantine. So I know it really got real for everybody else, just in the last month, but for us, it's been going on for a little bit. And it's only step one. Step two is the vaccine. The vaccine's going to be here at some point. There's at least 4 or 5 different vaccines being tested at this very moment. Once they become the known vaccine that will actually work and will be able to be used, then they have to mass produce it. Some bad estimates have been, I would say negative kind of concerns are it may not be here until this time next year or even a little later. More optimistic views are it could be here as early as late this year or very early next year. And so think about for the next few months, what are we going to do? Well, there's 2 pieces to this. One is something called herd immunity. So as we slow this down, we still know people are going to have it, right? They're going to have light symptoms. And so now those people, it looks like, will be immune. Okay, and so this isn't proven yet because, again, it's a new virus, but it looks like it's acting like almost every other virus, which is once you get it, you'll be immune to it. And so the idea behind that would be if we can keep it slowly moving through the community, we'll have enough people in the community to protect others. So in other words, it won't spread as fast. And so we'll have limited spread, most likely, for the remainder of the year until we get a vaccine. And then when that vaccine comes, the health department will actually stand up these pods, they're called points of distribution, where we'll vaccinate this entire community in a short period of time. And so we've done this before, we've practiced for this, so that'll be happening as soon as the vaccine comes out. And once that happens, then at that point, it'll be gone. So we really got a year of limited spread after this first wave. Now, there's been some discussion of a second wave. Would it come back maybe in the fall if we don't have a vaccine in time? Would it come back in a bulk way? We really don't know that. And so I think we'll know more about that over the next few months. But I think what's more likely to happen is after this first wave comes through, we'll have limited spread in the community. So when we open back up and we stop, we let businesses open up and the governor kind of takes off that order, he's still going to have things, and you've heard the governor and the lieutenant governor say this, we're still going to be talking about, okay, but let's open up, but still have some spacing and still make sure we're washing our hands, still make sure we're staying home when we're sick, those kind of things that we should be doing, and that'll still help. And so that's kind of what the future looks like. That's that's the best crystal ball I can give you, I guess I'll say. So that's kind of where we are.
And Dave, we had another question about, you mentioned businesses. So if a person feels like their business isn't essential, but they're still making them come to work, or they feel like at their company, they're not putting together the practices that keep people safe, what role does the public health department play in that?
So we've had 3,000 calls since this started. So we have a phone bank of multiple folks. We have phone banks that take general calls, a phone bank of nurses that take care of any medical scenarios. And then we have an enforcement team, if you will, that are sanitarians that normally inspect restaurants and schools and other things like that, which they're not doing that very much at the moment. They're just doing it in a limited way. And so those folks are all answering questions about this. And so we actually today up on our website will be here's the common ones we've made a ruling on that these are clearly not essential. And then if there are complaints, so let's say you're an essential business, but you're not trying to keep people 6 feet apart and you're not trying to do any of those things, and you're an employee of that business, you can call us and we'll get you to a person, and then we'll take the next steps. And some of those might be as simple as calling the business to find out, hey, what exactly are you doing here? We've had a couple of these before the order came out for the grocery stores and stuff to spread out. We actually had a few grocery stores and places like that were way overcrowded. And we had a conversation with their management and said, you need to knock this off right now. Yeah. It's not in the order, but you need to make sure you're taking care of it. And they did, and they made adjustments. So some of our grocery stores and places like that did the adjustment before the order changed. And
Nice.
so, yeah, so, and really, we've had really good compliance, to be honest,
Yeah.
among our businesses. But if you've got a question, you can call the main number, 440-56, I'm sorry, I almost gave my cell number out. I can't do that.
That would have been fun.
44, that's why I brought a number out so I would read the right one. 440-322-6367. That's our main number. You can call and we'll get you into one of those groups to answer your questions.
And I'm going to put that number on the screen so folks can see it. There we go, 6367.
That's it. Yep.
All right, Dave, any closing thoughts? I want to first thank you for this time, and thank you for being willing to speak to the community here about this and being flexible to use this new format, this new normal that we have to operate in. And just again, thank you for your transparency, your communication, and keeping me in the loop as in terms of what's going on. So any closing thoughts you want to share?
So I've said this a few times, and I want to say it as loudly and clearly as I can. The month of April is the most important month of this whole thing. Right now, I know we feel like you feel like it's going to be hitting, and we're going to get out of this thing, right? And we probably are. Okay, it's not that long, but the next 3 to 4 weeks are the most important weeks, not only here in our local community, but in this state, and frankly in this country, in many, many years. The next 3 to 4 weeks are really what it's all about. So please, for April, stay home.
Thank you so much, Dave, and look forward to chatting with you soon. And again, the phone number to the health department, you can go on their website. They have a ton of resources as well. And again, thank you, Dave, for everything.
Great to be here. Thanks.
So next, we're going to have a conversation on coping and mental health with these challenges that we're facing as a community. Oh, quick commercial. So before we cue Clare in, got a quick commercial. If you know of any senior citizens or anyone with a disability who's in need of food or toiletries or cleaning, please call this number, 440-305-0455 from 9 to 7, Monday through Friday. Or you can visit illyriacares.com and fill out a request form, and we'll make sure that those things get delivered to that senior citizen or that individual with a disability in the city of Elyria. So please go on the website, sign up, let the elderly folks know in your circle and your family that there's a resource for them and they should take advantage of it. We have a team of volunteers ready to serve, ready to come bring you your food, ready to bring you your toiletries, etc. We have been working with Second Harvest. They've been great partners in helping this come together. There's more information if you want to donate and support on illyriacares.com. So thank you to all the partners, all the volunteers that have helped out with that. You're true heroes as well during this time. So thank you. And definitely, if you know a family member that's in this situation, that's an elderly or has some sort of disability or compromised immune system and they need to stay in and their food needs to be delivered to them, we are delivering the Second Harvest food boxes right now to those folks. So please have them sign up. All right, now that commercial is over, now we can transition to protecting your mental health during this time. And with us this morning is the Director of Communication and Community Relations for the Mental Health Addiction and Recovery Services Board of Lorain County, Ms. Clare Rosser. So thank you, Clare, for being here.
Good morning, Mayor Whitfield. How are you?
I'm doing good. I like the background too. Nice royal purple you got going on back there.
Yeah, this is the color a 13-year-old chooses.
Yeah. Oh, dang. I feel bad. Now, that's like my favorite color, by the way. So yeah, thanks a lot.
It's very royal.
Someday my office may be that color, royal purple in here.
Nice.
But no, thank you again. I think during this time, it's good to be laughing with you because during this time, I think it's so important for us to be protecting our mental health. You and I have had many conversations about this. We worked on the How I Cope initiative last year when I was at the Urban, or the year before when I was at the Urban League, and I really tried to highlight healthy ways of coping. And during stressful times like this is the time to pull out those toolkits and start to utilize some of those coping mechanisms.
Sure.
So let's start off just talking about, how it's okay and you should expect to feel stress and anxiety right now. Like, I think for me at times, I'm fighting the feeling of it because I'm like, I got to tough this thing through. I shouldn't be, but it's like, Frank, it's okay. There's craziness going on. It's okay. You don't have to succumb to it, but also you don't have to ignore if you're starting to feel some stress. So can you just talk about the normalcy and your people's feelings right now and what they're going
Yeah.
through.
Well, and it's normal, even if it's not a global pandemic. Right now, we've got additional stressors, but the fact of the matter is our ability to cope and our ability to kind of manage on a daily basis is something that can be overwhelming to any of us at any time. Right now, we have a collective community event that is causing stress and anxiety for folks who may not have wrestled with that before or not at this level. A lot of that is because there's so many unknowns. As you heard from our health commissioner just now, we don't know everything, but we know that we're in some good hands here. We've got a lot of really good, smart people working on this, so that's a good thing. So the first thing is just to make sure that you're getting your information from reliable sources like the commissioner, because that helps with that uncertainty. You know, we're all figuring this out as we go. We're all feeling that stress and anxiety, but the more we can have that solid, information and know that we're all in this together, as the governor says, in this together, Ohio. So yeah, it's really very normal to be feeling this kind of anxiety and stress. And for those folks who cope with a mental illness or who are in recovery from a substance use disorder, this presents some particular challenges in their recovery. I think we'll probably talk quite a bit more about that, but this is something where everybody is feeling the stress, and everybody can help too.
Yeah. No, so that's great. So, what I'm hoping to spend some time talking with you today about is some of the resources available to people, to give some tips for folks on how to handle, some coping tips to kind of manage through this. And then again, we'll open up the lines to communication for questions that people may have. But we can pick up right where you left off, especially just thinking about those folks who may have already had pre-existing anxiety or depression, or substance abuse. How we need to be, in particular, extra sensitive during this time toward those individuals, because now things will be heightened. So can you kind of speak to where you were going in terms of the individuals struggling with substance abuse or pre-existing mental health conditions?
Sure. Well, exactly. The first thing that I've been advising folks, regardless of what your life situation is, think about people in your own life, your own circle. Some of the biggest protections that we can do for each other on a daily basis is just checking in. I loved earlier when you said keep the physical distance. You didn't say social distancing. Our social connection is so important and is such a protection for our mental health. So when you're thinking about the people in your life, give some special priority to those folks who may feel more isolated because they live alone. So they are more isolated than others right now. Give some priority to people that you know are coping with a mental illness. Maybe they have depression and anxiety that they deal with every day. And this is certainly something that can exacerbate that and mean that they have to use more of their coping mechanisms for that. Or someone who's in recovery from a substance use disorder. And just also be thinking about anyone who's had a major loss. And a loss can be defined in a lot of different ways. A loss can be a loss of a job. It can be a loss of a relationship. It can be a loss of stability of any type, which we're all experiencing that right now because there are unknowns. But these are the people that you should really put at the top of your list to give a call to every day and just check in. It sounds simple, but it's a huge protection, huge protection. So that's something that everybody can do. Now, as far as people who have already been coping with a mental health disorder, or they think they might need some services for depression, anxiety, or they're in their recovery journey for substance use, the good news is that mental health and substance use disorder services are essential. We're here. We are here. So sometimes the appointments look a little different right now, just like everything looks a little different right now. But we are here and open for business. And actually, we have some providers that are taking new clients too. So if as a part of this, you're experiencing a level of distress that you want to talk to somebody about, that's, we've got options for that right now. And I am so impressed with the local network of providers in the Mental Health Addiction Recovery Services Board network. They are being creative and responsive. My message to folks listening is keep your appointments. I know this is, there's a lot of changes to routine, but keep those appointments. Your well-being is essential. And if you're having a hard time, give a call for the first time. Or if you're having some stress, we'll give some resources on that too, some stress related particularly to the coronavirus and all these changes. But, we are open.
So you mentioned keeping your appointments, and through this time, I've seen a lot of things online about just trying to keep a sense of normalcy. A lot of folks are staying at home or working from home or laid off right now. But I've seen a lot online about still you should wake up, get dressed. Can you talk to a little bit about during these transitions of instability about keeping a sense of normalcy? Can you speak to that a little bit?
Yeah, routines can be really important, and actually just taking care of your general health now is it's important all the time, and it helps maintain good mental health all the time. Now, because we've lost some of those structures and those things that kind of put guideposts on our days, it's a little bit more difficult. We have to be a little bit more disciplined about it, but the payoff is great. So one thing that I always tell folks is that if you've ever experienced depression or anxiety or another mental illness, that's it might be a short-term thing, it might be a long-term thing that you manage forever, and you're susceptible to it. So if I have a diagnosis of depression at some point in my life, or I'm pretty sure I would have a diagnosis of depression, then I know, just like with high blood pressure, if I'm not sleeping right, if I'm not eating right, if I'm not taking care of myself, that blood pressure is going to spike, my depression's going to spike. It's all the same system here. So taking care of yourself is important all the time. We're all kind of adjusting to what that looks like for us now.
No doubt.
And I am going to be really honest right now. The whole routine thing has been difficult in my household. I got youngins who are doing the homeschooling thing, and so trying to balance all of that out. That's challenging, but
we were joking about that yesterday. I was saying that a couple of my kids got suspended from school.
Oh, yeah. I'm a big fan of gym
at home. They got ISA. Go to your room. You're an ISA now.
Somebody said out of school expulsion. We call it gym class. Go
run around the block. That was a good one. I said we were going to use that.
I mean, it's really difficult. So this is a situation where family members who may love and adore each other are with each other a lot more than they have been in the past. And all of those routines that help us be mentally healthy, physically healthy, those are trying to match up in the same space, sometimes a crowded space. This is going to take some adjustment. So if you don't get it right the first week, like I definitely did not, then forgive yourself and move on, and keep a conversation with those people and say, okay, so this was something that was a little difficult. What can we try that will maybe work a little bit better for us? And that's going to help. This is something to figure out.
No doubt about it. I love that. Prioritize your health. We're all adapting. Forgive yourself if you make a mistake. We're figuring this out. And then you think creatively. Whether it's putting a YouTube video on and exercising with the video, we still can go for walks. So that's still something that the stay-at-home order doesn't stop.
In fact, it's been noted by the governor and others as being essential.
Yeah,
to
yeah,
keep
exactly,
physical health.
exactly.
And if you are fortunate enough to live near a nice, beautiful, natural green space near your home to be able to walk, then take advantage of that, because there are actual changes to your brain that happen in that kind of natural setting, which is why we work so closely with the metro parks. This is a wonderful free resource that, you know, just going outside and walking and taking in some nature, it actually changes that response in your brain and can bring that stress level down. A lot of us know what we should be doing for managing our stress. Right? And on some days I'm like, okay, if you tell me to do a breathing exercise again, I'm just, I just can't take it. But the fact of the matter is, these are very simple things that can really work. So, so that's something where if you're having conflict or just any type of trouble, first of all, there are small things that you can do, like taking that walk. But while you're on that walk, if you're having a lot of trouble processing that stress, call the crisis text line or text the crisis text line. Yeah, let's talk about some of those resources. These are wonderful. The Disaster Distress Helpline, this is designed specifically for emotional distress related to a natural disaster or event like the virus. If you're having stress and just want to talk it through with somebody, this isn't to access, you know, testing or health services or things like that you would be contacting your local authority. Here it's the Lorain County Public Health, but this is someone that you can kind of talk through. You get immediate, free, confidential crisis counseling to talk through those moments of distress, those difficult moments. That's what the Disaster Distress Helpline, that 1-800-985-5990 that's up on the screen right now, that's specifically what that's for. Now, another phenomenal resource that I use, I've got it right here. So I don't know if you can see it. This is my phone, crisis text line. I have it in my contacts list in my phone, and I encourage people to.
No, we're going to do more than encourage. So I want everybody, unless you're watching this Facebook on your phone. If you're watching on your phone, you might not be able to do this. But if you're not watching it on your phone, you're watching on something else, I want you to put this number in your phone right now, 1-800-985-5990.
Okay, so that's for the disaster distress. So if you need to talk through stress related to coronavirus, if you want to have a general, helpline for anything that's going on with you, then the crisis text line. If you've got a phone that can text, put this in there, and that's just 6 digits, 741-741.
So this is who you're sending the text to. 741-741 is who you're sending it to.
Yeah, and if it's a crisis to you, it's a crisis to them. You can talk through any tough moment with them, and I've used it to get resources. I've used it sitting with someone. Here's a scenario. Let's say that you have a family member who is having a lot of distress and wants to kind of talk it through with you, and you're there for them. You can sit with them or talk to them video like we are if you're not in the same household, and say, hey, let's get out your phone. Let's text the crisis text line and see if they have any resources. You text, here's what happens. So you do a message on your phone to 741-741. You can text anything to them, but we like it if you start your text with the number 4 and the word hope, for hope. That initiates a call. They connect back through text and say, what's your crisis? And you can say, well, we're sitting here together and feeling a little bit of stress, worried that our depression might come back. Just want to kind of talk it through. They've got tons of resources, great stuff. They've got a whole library of things right there. So even if you're just curious about resources that might help, you're not actively in any kind of crisis, but you want to have some resources. In fact, as a part of your challenge to the folks who are watching, put that 741-741 into the contacts list of your phone, and then use it. Text them and say, do you have any stress resources for when I start to feel a little overwhelmed? They'll send you some materials. It's a free service. It's national. It's wonderful. And they will get you through, what they're really great at is getting through what's called a hot moment, you know, that moment of really high distress. They get you through that moment to a cool moment where you can cope a little bit easier. It's a wonderful resource, and I would suggest using it. So
I'm doing it right now. So as I'm sitting there doing it, I want everybody take out their phone if you can. I'm texting 741-741. And
ask them if they've got some good resources for stress. They're going to want to check in on your well-being and make sure you're doing okay. And they'll ask you some different questions. What you connect with is a crisis counselor who's been specifically trained to work with people over text. And like I said, it's a national line. They'd much rather you text them than not text them. You're not going to be wasting any resources. You're not going to be putting anybody out. You're not going to be, this is exactly what it's there for those tough moments. So we'd much rather you use that than not. Why not?
All right, I'm doing mine now. So as soon as I text, it sent me a text back and said, it's a crisis text line, you're not alone. By texting further with us, you agree to our terms, and then they tell you they can't do long messages. You got to be 160 characters or shorter, which is fine.
Mm-hmm.
Resources and coping skills. While we connect you, they give me a link, and then it's asking me what's my crisis.
That's nice. They're sending out resources right away. That's great.
Yeah.
See how fast that happened? Like you got an automatic message with some response, and then you're going to get connected into somebody who can text about your specific concern. It's just a really flexible resource to have. And I know plenty of folks who do have a mental health diagnosis who keep this in their pocket for when they know as part of their illness, they're going to hit some tough moments and need to talk it through and maybe not have their team of people with them right then. But they can use that in those tough moments. And I know folks who don't necessarily have any kind of mental health diagnosis, but we all hit tough moments occasionally, and it's better to work through those and have a resource that can be helpful. Now, I also suggest to the parents out there who are listening, this is a really good resource to make sure is in your teen's phone, because the data that we have in Lorain County shows that you can have a really strong relationship with your kiddo, and they talk to you about pretty much everything. The one thing that they're not going to talk to you about is when they're having extreme emotional distress. And often they might talk to a friend, and really you want to make sure that they have a resource where they're talking to someone who really knows what they're talking about. It's good that they've got their friends there to support them, and we do a lot of peer-to-peer training so that kids can support each other. But making sure and making it okay for a kid to use a resource like this can make a huge difference in that youngster's life. So we always encourage parents to have their kids put that text line right into their contact list in their phone, so it's in their pocket all the time.
So again, I have the chat going through on my phone. Definitely, you want to put that 741-741 into your phone, save that, and put that convo going. Also, that disaster distress helpline. Make sure you save that number in your phone as well. I want to continue to talk about tips during this time. So can you give us some tips on things people can be doing? You mentioned, general health. We talked about trying to keep a routine. Forgive yourself for any mistakes as you're trying to figure out this new adjustment, as we all will. Breathing exercises. Are there anything else you would like to elaborate on tip-wise?
Yeah, so to echo something I said earlier about getting your information from a trusted source like our health commissioner, also try to limit how much news and media you're taking in. There's a lot flying around right now, and sometimes choose your reliable sources. Check in with them. Probably every day, maybe once a day, because everything is changing really quickly with this. But don't have that be kind of a constant feed to yourself. It's very distressing. It's not going to change your you're already doing the right thing. You're staying home, you're washing your hands, you're checking in with the people that you know and love. You're already doing the right thing. So having that kind of constant stream of information is more distressing and can be exacerbating. So limit that media exposure, because the 24-hour news cycle is not something that we need right now.
And I've been saying, like, don't let COVID define your life, you know, and we as a city won't allow COVID to define our city, you know, so our world does not revolve around COVID. It's an element, it's a serious element that's going on within our lives. But I've been trying to do my best at reframing my thoughts to focus on what I can control, what I'm thankful for, and it's, you know, David mentioned it earlier just about family. It's given me a new appreciation for family and, you know, time. You know, I've been going in go mode for the past, you know, 15 years. We're nonstop, you know, and like the fact that everything is slowed down, it's like I'm starting to appreciate, like, wow, I appreciate the world slowing down. You know, I appreciate being able to spend more time with my kids. I appreciate, you know, the weather, the ability to go for a walk, you know, so just really having that gratitude and appreciation for what we do have and focusing on that. I know that's been a huge relief for me when I felt stressed, like, oh man, this is crazy. You know, I've had to turn off like you said, turn off the social media, get off of Facebook, get off of, you know, things that are just feeding me constant COVID bad news. And really starting to just look at the people around me and the world around me and being appreciative of what's there.
And you need to keep that so that you can be there for the people around you who need you. You need to not be depleted by all of that. So I agree. And it shows how people step up. I mean, Illyria, the We Care Illyria is a brilliant example of something that we promote in mental health, which is just watching out for each other. It's often that neighborly.
It's like sometimes you're focused so much on yourself that that stresses you out more. But when you start to care about others,
And here is a very nice way that our brain is wired. When you do those neighborly things for someone else, it gives your mental health a boost too. That's why volunteering is something that's good for mental health. Sending those little, you know, notes and cards and calls and well wishes to other folks. I heard a story from a friend the other day who was talking about, you know, she wakes up every day feeling grateful for her ability to kind of weather this. She's got her family around her. And so she wasn't really thinking of herself as being one of those folks in need for connection. But then her church family stopped by and just, I think, showed little signs through their window or something like that, maintaining the physical distancing, but was just checking in. Nice. And it gave her such a lift. And you know that it gave the folks who were going around and cheering stuff. That was, you know, that was a boost for them too. Wow. So that's something that's hardwired in. Yep. It's in our brains right now. Yep. If we can help someone else out, we are socially wired creatures, and that helps our well-being. So
and that's actually one of the pieces we've built into the We Care. Again, this piece has been moving, and one of the things we said was we're going to start to do care calls. So, you know, not only just delivering the food to the seniors or the folks who need it, but throughout the week, just calling and having conversation. How's it going? And again, just because we have to be physically distant doesn't mean we have to be socially distant. We can still, like you said, we're wired for human connection and interaction. Yeah. And so, though we may be in separate places, I think this is forcing us to be more intentional about reaching out to people via text and call and really checking on folks. But
and part of that checking in with people is to take it seriously when you're seeing some signs that they may be having a higher level of distress. And that approach that I discussed of, you know, share these, when you call someone to check in on them, make sure they've got that disaster distress helpline, make sure they've got that crisis text line, share this information with them directly and say, hey, you know, we're all hitting some tough spots. So use this when you hit yours. I'm going to use it for me.
Yeah.
And that makes them feel like they've got some backup, and they're not so alone, even if it may be a moment where they're feeling very disconnected. They'll have somebody to connect to. And these are real people on the other side of these lines.
Awesome.
So, and don't be afraid to say, hey, it seems like you're having a hard time. Let's talk through this together, and let's connect in with some of these resources and see if they help.
And I just want to reinforce that it's okay if you're having a hard time right now. You know, I think that, you know, some of the folks I've had conversations with, again, they're like they're mad at themselves for this being a hard time for them. It's like, it's okay. This is not normal. It's okay to, you know, feel scared or feel anxious, and you don't have to stay there, but don't feel like this is foreign, and don't make dramatic decisions now out of this. Don't, you know, feel like, you know, you have to do something dramatically that could be detrimental to you long term, because like, have the awareness that, hey, I'm already under stress. So if something else happens, I may react stronger. And, you know, we talked about relationships and things earlier. You know, we talked yesterday about, you know, the increase that we're seeing in domestic violence calls and domestic disputes. And again, people can still go for walks. You can still, you know, get that breather. You know, people were joking saying now every day is Thanksgiving, you know, and the tense, you know, that happens around, you know, Thanksgiving dinners, and like, people are experiencing that every day. And so I don't know if, you know, from an anger management standpoint, if you can speak to that, or speak to, you know, how we can kind of manage within these relationships, and being patient with each other, knowing within these relationships, everyone already is at a increased level of stress. So yeah, you didn't wash the dishes, and now there's you know, you're wondering why your spouse's reaction is so strong. Well, they were already at 8. You know what I mean? So this just took it up 8.5, and 8.5 is where there's an issue. So can you kind of speak to just the relational management side of this in terms of households?
Yeah, and I will make a distinction here. There is, abuse is not okay. If there is violence within a household, please contact Safe Harbor Genesis House. I'm going to give you that phone number right now, 440-244-1853. They've got another number that you can also call. It's the same route, 440-323-3400. They're on Facebook. I think, Mayor, I provided some Facebook posts to you that includes their information that you may be able to put out on the Elyria page if you haven't already. Yeah, so you're right. We are going to be in very close quarters with each other with a lot of stress. And if it's a family that, you know, is fairly harmonious together, there's still going to be a lot of stress in that household, and you're going to need to kind of figure out how to manage that. If it's a household that is violent or has abuse within it, I think that is, that's why we're seeing, I read last night a New York Times article that there's a worldwide increase in calls to hotlines like our Safe Harbor and Genesis House. Use those resources and keep yourself safe. For a family that is just kind of trying to navigate a new normal and has stress related to that, as far as anger, this is something that when I do my mental health 101 or my suicide prevention trainings, these different things, I think what people forget is that depression looks different in different people, and anger can actually be what depression looks like for someone. So it may be that if your emotional distress expresses as anger, you may be dealing with depression, an underlying depression. And the really great news is that depression is treatable in a lot of different ways. There's a way to kind of do what works for you in the care of a clinician, and it can be a short-term piece as well, or it may be something like that high blood pressure that you know you're prone to, and it's going to rise up every once in a while, and you just need to invoke your coping mechanisms when those times come. But anger, I think people think of depression as extra sad, really sad, but depression can look different. It can look like anger. It can look like numbness, just no response, no reaction at all. These types of extreme emotions can be a sign that something a little deeper is going on, and you should probably deal with that. And fortunately, in Lorain County, we've got a lot of resources to help with that, so that it's not something that you have to do and feel forever. This is something that you can move on with and be a strength to the people around you, rather than rather than feeling this way when there's treatment available. So, there's a lot of good options, which actually I think, so I see on the screen that to get help with your general mental health, that 1-877-275-6364, that's the state mental health referral line, which they've extended the hours on. I'm thrilled. Our governor's response, he is a huge mental health and recovery advocate, and has been making a lot of really smart decisions to make sure that care can keep going, and has extended hours for people to access different resources like this. So this is something you can call between 8 a.m. and 8 p.m. on any weekday to just see what's available, and what's available near your home. And you can also call or check our website, has all the local resources that we fund and monitor through the Mental Health Addiction and Recovery Services Board. And that is MHARS LorainCounty.org. So it's MHARS Lots of good resources there to share too.
And we'll have this presentation available to everyone afterwards. So these phone numbers that link to the website Claire just mentioned will be on there as well. You also mentioned Governor DeWine. I definitely want to give a shout out to Governor DeWine and Lieutenant Governor Husted for their leadership. Dr. Acton at the state level, they've just been great leaders, not only here in Ohio, but throughout the nation and the world, actually, has been recognizing their leadership as a first-time mayor within the first 100 days dealing with a global pandemic. Having strong leadership to be able to follow has been a blessing. So I just definitely want to give a shout out to Governor DeWine and his team for their leadership. We do have some questions coming in through Facebook. So Ren, you want to ask some of those questions?
Absolutely. So Claire, we have a question coming in from Facebook, and some of these questions are geared towards youth.
Sure.
Someone wanting to know, let me find the comment, if you can speak to kind of the best way to talk to children about what is happening without alarming them, and kind of helping them to feel safe and protecting their mental health during this time.
Oh, that's wonderful. And actually what I'll do is there's some very good guidance that has been put together for parents of children of various ages, because clearly the way you talk to a very young child about what's happening or a teenager about what's happening are different. So what I'll do is I'll make sure to provide those resources to Mayor's team, and that way it can go out through the Facebook page. Is that appropriate?
Yep.
Okay. But I would say, in general, a good guide with children is to just make sure that that line of communication is open. Ask them open-ended questions, not yes or no questions that can kind of shut down, but just ask them questions about how they're feeling about things. And then they know, first of all, that you're safe to talk to, because sometimes they get questions that we as parents cannot predict that that's the thing that they're worried about. Sometimes little ones have very concrete fears, like, where do I hang my coat? Where do I do these things? And it's disrupting their general day. We don't think about those things. We think about kind of the bigger issues. So we may not realize what's going on in the youngster's head, but just keeping that line of communication open, regardless of the age. And that way they'll come to you more likely if there is something that's bothering them. So that's a really good general piece to keep. And if it's a teenager who you feel like they're shutting you down every time you try to talk to them, they hear you. They know you care. You're expressing you're caring for them. So just keep it open, and I'll make sure to share those resources specifically to natural disasters and to the coronavirus. Please check the Facebook page for that, because there are some really good, smart people who are putting together those resources, because we're all dealing with a changed world, and it's particularly confusing when you're a youngster.
Yeah, I thought about, for a child to just be told, hey, no school, you're at home, that's a huge traumatic disruption to their everyday life. And, this is going to shape their world. You know what I mean? I thought about like when 9/11 happened, depending on where you were, how that shaped your worldview. And, how at this impressionable age, this is shaping their worldview.
Here's something that I would love in response to when you put that Facebook post up. Ask people creative, cool ways that they have found to help their younger ones handle the stress of this situation. We've had there are all those wonderful things that are happening where people like hide teddy bears in their windows, so that when little kids go on a walk, they're on a safari hunt and they can see the different teddy bears in the windows. We did at my house, we have a neighbor that we love, and she is working from home. So we, and her desk is right next to the window that faces our kitchen window. So my kids on her birthday made a big happy birthday sign and decorated our window, so that when she came down to work, she'd have a happy birthday sign waiting for her right across the driveway. I know of kids who, oh my goodness, they're having their birthday, and it's such a weird world. They can't have their party. They can't do all the usual things. They can't get together with their friends. So I know of a couple that they had their neighbors bring a picnic blanket out to their front yard, and they had a little picnic, and they brought their little daughter out to have a picnic on their front yard.
Nice.
So they're like 12 feet away from each other, but they're having a picnic party for their birthday.
Yeah.
It's these kind of great ways. I'm seeing this whole situation is stressful and devastating, and yet the great things about people rise to the top.
Yes. That's the American spirit. That's the hilarious spirit. It's the human spirit. It's the people have had concern and anxiety, like, oh man, there's been this whole wrestling between the economy or people's health. And I'm like, if the economy goes down, we are too innovative and creative and hardworking to not rebuild this thing 10 times stronger. Like, we'll be okay on that. You know what I mean? Like, take care of yourself. The economy will be fine. We'll bounce this thing back. We're smart enough. We're hardworking enough. It's in our DNA as a country to build from nothing. So we'll be fine no matter what. And then again, around just the human spirit and creativity, I just believe. I don't know if it was true or not, but I saw something online that said, and that's again around.
Seniors not.
It said,
limit that.
It said like during the Black Plague is when Isaac Newton discovered the law of gravity. It's like during that time. I don't know if that's true or not, but I know that during these times where you have time to reflect, you have time to be in your own thoughts at times and kind of connect with yourself, connect with nature. Some of the most creative music is probably going to get birthed out of this. Some of the most creative ideas and solutions will come out of this. So I also just want to give people the permission to be creative, to try out new things. Forgive yourself if it doesn't work. Hey, we tried the outdoor picnic and my neighbor didn't show up. All right, that's fine. Try something else now. We tried the teddy bear thing, but no kids came down the street. Okay, that's fine. Let's try something else. And that's the same conversation we're having here at the city. Even with departments, it's like, all right, if our recreation department, our mission is to engage people in some sort of recreation, all right, this aspect of that has been cut off, outdoor basketball or using a rec, but we have yoga instructors and we have a camera, let's put a camera on, let's put it on our cable television station and let's do some yoga for folks who are at home. let's do crafts, you know, the same thing. Let's see what we can still do just within the same medium. And
Right.
so,
And on some days, just meet your basic needs and get
yeah,
through it, and forgive yourself for that.
yeah,
Like,
yeah,
don't put a ton of pressure on
yeah,
yourself that you are, it's like, oh, I need to use this time every day, every minute.
yeah,
Some days you're gonna get your basic needs met, and you're gonna move on. And then when
for sure.
creativity strikes, you'll be ready for it.
For sure. That's real. That's real.
Yeah.
Yeah. The workaholic part of me is like, yo, you know, we'll figure out something. Let's keep things rolling. But to your point, though, as I mentioned, I've been running this rat race for the past 15 years, nonstop, full court press, the whole game. And now having a time to kind of slow down, I have appreciated. And I think for those, you know, I grew up in a household where all my parents did, all my family did, my mother, all she did was work. It was work,
Yeah.
work.
Out of necessity. Yeah.
So like now that she has a chance to kind of relax and stuff, I'm like, so I'm trying to tell myself like, also relax. But you know, we got a city to run, so it ain't too much relaxing.
Right.
Again, salute to all the first responders, police, fire, sanitation,
gosh.
are out there working every day.
And the mental health clinicians too, amazing.
Yes, yes, the mental health clinicians, the nurses, the doctors, all those folks who aren't able to work from home and aren't able to take a break during this time. And actually some folks, the work has increased. I know for our sanitation department, because so many people are home now, there's just way more trash. Everybody's doing their DIY home projects now.
Spring cleaning.
So their workload has increased so much. So I just want to definitely give them a shout out and let them know we appreciate them. Rin, we got a couple other questions from Facebook.
Yes. Claire, pull this. John is asking if we suggest our grandkids enter the For Hope text line, should they mention their age when they text? Do counselors need to know they're interacting with teens or children?
I mean, that's a good idea. And if it's a child, the assumption is that if the child is old enough to have an unsupervised cell phone, then they're probably able to access this on their own, as long as that's something that they're that their family is okay with. It's great that a grandparent would be encouraging them to use that resource. So yeah, I mean, it's always a good idea. A young person interacting anywhere online should make sure that they're using only what's safe and appropriate and approved by their family. So yeah, and the crisis counselors, you know, they're very used to dealing with young people. They're used to dealing with all ages, so they know how to kind of ask the right questions to make sure that what they're providing is developmentally appropriate.
Claire, can you speak a little bit to the transition for people that might have had more of a traditional in-person therapy that might be doing now tele-therapy or counseling? Can you provide any tips for making that transition, how to engage during those video sessions, and how to just keep conversation flowing? Yeah,
so the first thing is to keep in contact with your provider and ask those questions of your provider, because everybody's going to have a little bit of a different approach. But a general trend that we're seeing is that first we have to start with the assumption that there is a secure telehealth technology on both sides, so that the person can access what they need to access. That's something that the provider will assess to make sure that the person has what they need. Then the other piece that we're seeing is that sometimes those sessions might be more frequent but shorter. That's something that you can discuss with your provider. The in-person therapeutic environment and the online therapeutic environment are still face-to-face in the most real of ways, but are a little bit different in structure, so that you may take advantage of that with your provider. So there's some kind of creative approaches. And again, the state has been really great about updating policies and whatnot to be able for local providers to be able to do that more flexible, creative therapy and therapeutic treatment in a way that works best for the people who are being served. So first ask your provider, and then just know that you may have a situation where it's something like this, a video telehealth. It may be or it may be there are still some in-person with precautions it really depends on the provider. Just ask that question to them.
Great, thank you. Any other questions, Ren, from Facebook?
Yeah, we have someone, we know that you all spoke about kind of taking walks and getting out a little bit, but can you speak a little bit about some self-care ideas during the quarantine, and then just self-care in general?
Yeah, so there is a real simple technique. It's called 1, 2, 3, 4, 5 grounding. So if you feel your emotion rising, whatever your distress emotion is, if you're feeling sad, if you're feeling angry, if you're just feeling not like yourself, then just stop and take a moment, kind of sit down, focus on something in the room, like pick an object and just start doing that breathing in and breathing out. And again, I'll send this this resource to you to share on your Facebook page. It's a nice grounding technique that is that's, notice the smells around you. Breathe that in. That's number 1. Notice the feel of the floor on your feet. That's 2. And then you end with think about something good about yourself, and then just breathe. That's something that brings you back into the moment. Sometimes I think a lot of what Mayor Whitfield was describing is that you get, kind of focused on all these different things, and there are all these different pressures or worries and things. Well, we can take 5 to 10 seconds to bring ourselves back into ourselves, and it makes more of a difference than you could imagine. And also, I think the importance that we talked about of keeping a routine is a major self-care piece. And even though we are in a different situation, think about those things that give you joy and keep those going as much as you can. If you're a person who, loves game night and used to have everybody over for game night, well, see if there are online board games. There are all sorts of things like that you can do with friends. If it's that friend connection that you're missing, then there are lots of different online resources like this where everybody's faces can pop up and you can talk. And you can even do that with groups of neighbors and connect in that way. And even though that's care for a group, that's self-care as well, because like I said, it boosts your own well-being to do those kind of reach outs and connections. So think about the things that give you joy and modify those as best you can to keep them going.
Oh, that's great, Claire. I know one of the things I had shared with you yesterday is for so many people, faith is an important part of their journey, and faith is a way that they also grapple with mental health. You mentioned thinking about things that are joyful and things like that. Sometimes that thinking is about a scripture, a passage, or a quote that refocuses your mind. And I know a lot of churches have been, and other faith communities that are accustomed to gathering, have kind of struggled with this new dynamic of not being able to physically gather in the same space. But I've been seeing creative ways of people still providing virtual messages and virtual services. But I've been really challenging a lot of people in the faith community to use this time to establish genuine relationships with their congregants, and now is a time to kind of get beyond any kind of shallow, kind of routine that people were used to of just showing up, leaving somewhere. And now's the time to actually call and connect with people, and because that's what people are hungry for right now, that connection. So just really been encouraging a lot of folks in that community to use this time to connect with people within your congregation via FaceTime, call, etc., and have those genuine conversations. And and really, I know personally for me, I've went to my faith a lot throughout these times to try to keep my worldview healthy in terms of what's going on. And again, reminding myself what I can control and what I can't control, and making sure I'm focusing on what I can control.
Yeah. And the faith community can be a wonderful protection for people's mental health through fellowship and connection. I'd also like to mention there are, if this is something you're interested in learning more about, we can help with this, the Mental Health Addiction and Recovery Services Board, is we have a faith leaders roundtable that grew out of the recovery movement. Churches that wanted to help their congregants who are on their journey of recovery, typically from substance use disorder, and it's building out to places that support people in their congregation who have a mental illness. This is something that, you know, if you are a faith leader and you want to expand or learn from other congregations that have done that kind of support, this is a great time to reach out, and we'd be happy to facilitate that. So if you're interested in that kind of thing, you can contact me at the board. You can really just call the general number at the board, and especially we'd love to hear from people who aren't already involved with us, who have recovery ministries as a part of their church family. That would be something that can be a great resource during this time too. And on that same vein, there are opportunities outside of the faith community. There are lots of different fellowship opportunities for the recovery community. If you want to check our Facebook page, we've got online recovery groups that are operating during this time.
And do you have a URL for your Facebook group? Is it facebook.com/something?
It's actually not. They're not all Facebook groups. It's different platforms to be accessible to different folks. But if you go to our webpage, then you'll get the full list of all the different.
Gotcha.
Yeah, because there's family support and there's direct support and those kinds of things.
So if you go to this MHARS MHARS, MHARS.org.
MHARS, yeah.
We're
MHARS. Yep.
No doubt. So Claire, thank you again. You want to give us any closing thoughts that you have?
You know what, there is a quote that I have been really resonating with lately, and that's, I cannot do all the good that the world needs, but the world needs all the good I can do.
Read that one more time.
I cannot do all the good the world needs, but the world needs all the good I can do.
That's good. That's good. That's good.
Watch out for each other.
Yes.
We're here.
No doubt. Well, again, Claire, thank you for spending some time with us, sharing with our community some of these resources. I mentioned we'll keep these resources. We'll post this presentation, and just appreciate all you do for this community and what you do for the MHARS board, and just looking forward to continuing to work together to help improve our community.
Thank you. We'll talk to each other soon, I'm sure.
Yes, no doubt. Thank you, Claire. Take care. All right, next we're going to be talking about small business, but we're going to have a short dance break. So I want you to stand up. And if you've ever been to any of my public events, you know I'm big on dancing. I always make everybody get up and dance. So that is about to happen right now. So I'm going to get up out of my seat. I'm going to move my screen up. Ooh. And if you have video up, we can get their videos open. If you want to show up other folks out here what they got going on, we can get Derek out here dancing with us. And we're gonna get it some movement. Thank you for indulging in that. Thank you. And so great segue to getting our movement going, because next we're going to be talking about small business. And as many of you know, there's been a lot of changes in the business space, and we're going to be sharing some of those resources. And I'm so excited to be here with the director of the Small Business Development Center at Lorain County Community College, Miss Lisa Hutson. So thank you, Lisa, for joining us. And thank you for dancing with me too. Thank you.
Thanks.
So we're going to spend some time talking specifically about COVID response and resources. But even let's start off kind of talking about prior to all of this. Can you talk a little bit about the Sbdc and what you all do for the community? I'm gonna grab a water real quick.
Okay, sure. So the Small Business Development Center, there are about a little over 30 centers throughout the state of Ohio, over 900 nationwide. So we're a resource that's available all over the place for small businesses. In the state of Ohio, we are funded from the Small Business Administration at the federal level, the state of Ohio, and in my case, we are funded through Lorain County Community College. And really, it is due to their generosity that allows us to be a very robust center. And we work with business owners kind of in all phases of that business life cycle. So we work with people who are just kind of kicking around an idea about starting a business, people in that startup phase, people in the growth phase, or people that maybe have built a business and they're looking to sell it or move on and do other things with their lives. So we work with all industries. So it's exciting in that we might work with someone who has a food truck, to a manufacturer, to a consultant, to a hair salon. So we work with all types of industry, and we work with clients one-on-one advising. We do small group counseling, workshops. Now that's all become webinars, but yeah. And so we are really there to be a resource for business owners in all kinds of ways. We have expertise around business planning, strategic planning, access to capital, HR, accounting, record keeping, process improvement, innovation. I'm sure we do a lot around social media marketing. So really anything that a business needs. And the great thing is about 99% of what we do is at no cost to our clients.
Oh, that's awesome. So thank you, Lisa. So you and I have had a chance to work together for a number of years helping small businesses. And now we're in these unique times where businesses are struggling in trying to decide, if they're going to be able to stay open. They're trying to figure out if they're, how to, make it, how they're going to make payroll, pay utilities, if they, should lay off, et cetera. And they're trying to figure all these things out. And then the federal government passed the CARES Act, which released a lot of resources around loans and grants for small businesses. So if you can just speak to, how you all at the Sbdc are adapting to things and what you're seeing and what resources and how you're advising businesses to approach this.
Yeah, so first of all, I want to, if people didn't know, yesterday the governor announced a new resource for small business called the Office of Small Business Relief. And you can access that at coronavirus.ohio.gov/business help. It's kind of like a statewide resource for businesses. So it brings all of the business resources available to one place and answers a lot of those frequently asked questions. So that's a really good site for small businesses to go to if they have questions. Really, our role for this is right away, we started getting questions about what is the right loan product, and let me backtrack a minute and really say there's some three main sources for businesses right now from as far as a funding resource. And those are through the CARES Act, there's what's called the payroll or Paycheck Protection Program. And with this program, a business owner can get 2.5 times their average monthly payroll and up to $10 million. And we say small business, but for most industries, that really is about 500 employees or less. So that covers a lot of businesses in Lorain County. And you would apply through that program through your bank. So whatever bank your business has its bank account, I would start there. It's an application, and we've been hearing that the turnaround time on that funding is pretty quick. And if that money is used for payroll, it can be forgiven. So if 75% of it needs to be used for payroll, and there's some caveats around maintaining the same level of staffing. So even if a business has laid off employees, as they have a certain time frame to bring those employees back and get to that level of staffing. And so if the money is used for that, it can be forgiven. There is some wording in there that up to 25% of those funds can be used for things like interest on a mortgage, rent for the business, or utilities. But really the focus of that is to allow businesses to keep employees employed and the business going. So that's the Paycheck Protection Program. Second is the EIDL, the Economic Injury Disaster Loan, that's through the SBA. This loan you would apply for through the SBA's website. And they simplified the process. Now I did hear yesterday that website was down for a little bit, but that is based on up to $2 million. And that is really to keep the business in business. So where the Paycheck Protection Program is really focused on payroll and keeping employees employed, the EIDL is really focused on more of the working capital needs of the business. So that could be things like you need to pay your vendors, you need, maybe you have an equipment loan that the payment is due. You know, it's not to consolidate debt, it's not to buy new equipment, but it's really those working capital needs of a business. That loan, the nice thing about that loan is there is an opportunity to get up to a $10,000 advance on your loan. And that advance would be forgiven as long as that money's used for working capital needs. So, yep, and so that's right there, that's up to the $10,000 advance. But I have to warn, the questions I'm getting now are people applied over the last couple weeks and they haven't heard back. And so statewide, just talking with our network of SBDCs, very few of our clients have heard back yet. So if you applied and you haven't heard back, don't panic. It is going to start to come. As long as you got that confirmation number of your application, you're in the queue for that. So, but I think—
Lisa, we're going to take a quick pause. I'm sorry, we were having some issues with the live. Let me see if we got it back going. I want to make sure people don't miss this. And by the way, I've loaded up the SBA website.
Okay, great, thanks.
And I can load up any other site as well. I also have the Ohio site you mentioned, Office of Small Business Relief.
I just got breaking news. Bernie Sanders dropped out of the Democratic presidential race, just an FYI. While we're so.
Yes, interesting times.
Yes, exactly. You heard it here first.
Yeah, yeah. She said that playing the music is what threw it off. I thought I did the disclaimer and said, hey, we don't own this music, but I don't think that was enough.
All right, 1 second, y'all.
Sure.
Thanks for your patience.
Said that music threw it off, huh? They thought I was scamming music.
I saw the message came up that said the video was blocked in 244 countries because of Sony, and I was like, no.
Oh, dang.
All right, the live should be setting up in 1 moment. It's loading now.
And Lisa, we'll just we'll start from the top. Yeah, I just want to make sure we don't miss anything in this one. Forget that.
All right, y'all, we're live.
All right, we're back. Sorry, my little watch party messed up the live connection playing that music. I guess we didn't, I said we didn't own the right to the music, but I guess that wasn't enough. Again, we're here with Lisa Hutson from the Small Business Development Center, and we're gonna talk about resources for your small business during this COVID-19. And Lisa, you were just telling us about, there was a new announcement from the state of Ohio about a new small business relief program. If you could speak to that again. And then I'll pull up the websites, and then we'll talk about the different options we have through the CARES Act.
Okay, great. Yeah, so the governor just announced a new site. It's the Office of Small Business Relief, and it basically pulls all the resources available for businesses during this time in one place and answers a lot of questions. And so that website is coronavirus.ohio.gov/business help. And just to let you know, I didn't mention this in the past, if a business wants to be emailed the most up-to-date information as new information comes out, they can email businesshelp@development.ohio.gov to be put on that email list for direct email updates. So again, that's businesshelp@development.ohio.gov. But that's a great starting place if you have questions. But again, we're happy to help you as well through the Sbdc.
And then you were sharing that through the CARES Act that was signed, I think, a little over a week ago, there was these various tools that are now available to businesses. And so let's talk through those.
Okay, so the first is the Paycheck Protection Program. This program allows a business to get 2.5 times their average monthly payroll. And it's pretty broad, the types of businesses that it can apply. It can be for-profits or 501c3s, 501c19s, which are veterans organizations. And it provides the business with 2.5 times average monthly payroll, and it's to be used to keep employees working. And as long as the employer uses the money for payroll and gets their employment level back to pre-coronavirus levels, that money can be forgiven. There are some caveats for it. They are allowed to use up to 25% of that money to pay interest on a mortgage, to pay rent for the business or to pay business utilities. But it's really, the focus is to pay payroll. So if a small business has laid people off, once they get this funding, they have a certain amount of time to bring those employees back. Or if an employee maybe has found other work or is doing something else, it doesn't have to be that exact person. It just has to be that employment level. So that's the Paycheck Protection Program. And it can, business can borrow up to $10 million. And most businesses are gonna qualify for some kind of funding through that program. And with that program, you would access the application through your local bank. So the best place to start on that is with wherever the business currently banks. Some banks are only working with current customers, or if a business needs help connecting with a bank, we're happy to help do that too. But really starting with their current bank is the best way to access that program. Now, there is limited funding for that program. And so there is a sense of urgency to get your application in. Although I have heard that Congress is already working on expanding the funding, but if that's a program that you think you're interested in, I would get to your bank sooner rather than later to get that process started.
Gotcha.
And, you know, I do want to put out there the disclaimer that everything I'm saying is effective today. There has been a lot of changes and updates in these programs. And so just when we think we have the final program figured out, there's changes. So, but everything I'm saying is current as of this moment.
Yeah, this thing is ever changing, no doubt.
Yeah.
So you want to go to the next one, the EIDL loan.
Yeah, so that's the Economic Injury Disaster Loan. And this program is directly funded through the U.S. Treasury. So this program you would not go to your bank for. You would go to the SBA's website. And there's two components to this. This loan is up to $2 million. And it's really where the PPP, the Paycheck Protection Program, is to help the business keep employment and their employees going. This loan is really for working capital. And there is a component of it where a business can qualify for up to a $10,000 advance, and that advance would be forgiven. So again, eligibility is pretty broad with this. It's for-profits or nonprofits, private nonprofits. And then there's the loan component, and the loan component can be used for really all those working capital needs. So things like to pay your vendors, to get your suppliers, maybe you have rent due that isn't covered under your PPP. And a business can really get all three of these components. They just can't use them for the same purposes. So there's no double dipping. So if you're using the Paycheck Protection Program to pay your payroll, then the EIDL loan would really be for those other working capital needs to keep your business in business. It's not to, the EIDL is not to buy new equipment. It's not a time to start a new program with your business. It's really to keep the business up and running during the time that we're down for the coronavirus. The great thing about the EIDL loan is that it's a fixed rate of $375 for a for-profit business, $275 for a nonprofit. That's a fixed rate, and the term is 30 years. And that your first payment is deferred for the first 12 months. So it really gives a business time to get back on its feet before the first payment is due. And because the term is so long, it really minimizes the payments. So a business owner may take advantage of all three of these programs, but that's where we can really kind of help a business owner to sit down and look at the funding available and what's going to work. Right now, we're encouraging business owners to apply both for the PPP and the EIDL, see what they get approved for and what they qualify for, and then let's sit down and see the best uses of the money. There's no application costs, and you're not required to take the money if you're approved, because there might be some situations where one of the loans might be a better fit for a client than the other. The thing with the Paycheck Protection Program, if a client uses those monies in a way that maybe is not a forgiven reason, the rate is good at 1%, but the term's only 2 years, so that can create a pretty hefty payment due for a client, and it's deferred for only 6 months instead of 12 months. So there are some reasons why a client might choose one or the other, or a combination of both, but our goal is to get them all their financial needs with the least amount of repayment required.
That's great. So if you are looking for assistance, a small business, and help with these programs, as Lisa said, you start with your bank, but you can also contact the Sbdc and then also the City of Elyria. We, this past week, put a team together here at the city that will be able to respond to help you through this process. So you can contact Dawn Calvert, and Dawn will be joining us in a little bit here. But Dawn, and here's her phone number, 440-281-0992. Or you can go on cityofelyria.org and complete this form, and we'll follow up with you. And we'll be working in partnership with the Sbdc as well. So, so you mentioned some of the federal resources, state resources. What else on the local level is available for small businesses? And then I want to also speak to businesses that are trying to make it during these times, and some tips for those businesses, in particular restaurants and small businesses that are trying to make it happen during this time. But I don't want to miss out on any other resources that we may want to mention.
So right now on the local level, there's not anything. We hope that's going to be changing in the near future, but I don't think we're ready to make any announcements.
I know. I was wondering. I was kind of queuing that up too. I know.
I was hoping you would not.
So there is something coming from the county's perspective, but again, the City of Elyria has already put a team together. We're working right now in partnership with the Sbdc to try to figure out a countywide initiative. But we're definitely wanting to hear from the business community of what your needs are, so that we can help you come out of this stronger and make it through this. You know, not only the relief, but also the recuperation and recovery from it. So for businesses, what else are you seeing out there also for businesses that are currently trying to operate within this? Businesses that haven't closed down and are trying to figure this out, you know, what are some of the advice that you're giving to those businesses?
So here's the thing, whether you're operating right now or not, you can't stop communicating with your target audience. And kind of all those things we talk to clients about in good times, it still applies right now. You have to know your target audience. You have to know why you're valuable to that target audience, what problems you're solving for them, why you're important. And you need to stay in front of them through communication. So having a really good marketing plan with social media. I know on our Facebook page, which is LC3 Sbdc on Facebook, we have a lot of webinars, a lot of features. We are doing Facebook Lives almost every day on different topics. A lot about it is kind of this crisis communication marketing. But Frank, you alluded to it before, that sometimes out of crisis is a time businesses can start or thrive, find a new niche that they can maybe see a niche that's not being serviced properly. So everything is not doom and gloom. I understand for a lot of businesses right now, it's about survival, and hopefully some of these resources we just discussed will help with that survival. But you really need to think about what's going to happen and what's going to make your business thrive past 6 weeks from now, or 8 weeks, whatever that number looks like. And you can't disconnect. That is my biggest thing. You have to stay connected with your businesses, and be that social media, be that, we see a lot of gyms and trainers online doing videos, but there are a lot of businesses doing a lot of different things. We work with a company that does those paint parties where people get together and paint, and they put together like art kits.
Oh, nice.
So think about ways that you can connect with your customers.
Yes.
If nothing else, if it's just on marketing and being out there and getting to know your customers or your target audience better, that's great. But if there's a product niche, it's really time to kind of, and I hate this expression, think outside the box, but really to think about what are those different revenue streams? We have a live Facebook Live on our Facebook out there about getting up and getting ready cheap and quickly for e-commerce. So if your business historically has not done e-commerce, there's ways to get up quickly. And then by doing some new things, you might find a new sustainable revenue model that you're going to continue past this crisis time. And so now's the time that you can experiment and try some other things, see if it's going to stick. And if there's, because even when we get back to normal, I think it's going to be a new normal.
It'll be different. Yep.
You know, and I think people are going to realize I don't have to run to the store all the time. I mean, you know, we were already moving toward more of an e-commerce business model anyway. And I think that's only gonna grow, since people who maybe never tried it before are trying it now.
Yeah, exactly.
And so, and they realize the ease of it. And, you know, your business might not be the new Amazon, but you could be an alternative to Amazon.
Yeah, exactly. That's great insight. Now, what about for those businesses that maybe through the stay-at-home order, through the governor's orders, they've had to close? And so how do you think they could be using the best use of this time while they're not in operation? You know, what's your advice to those businesses?
Well, you know, I think the one thing I see a lot of businesses, and I'm not talking just a small mom and pop businesses, even pretty big businesses. A lot of time businesses don't understand their financials. Maybe they don't have a great accounting and record keeping system set up. So now's that time to use that downtime and really get those things established and understand your financials and understand what your cash flow needs to look like when you come back. Or maybe it is to start building a marketing plan and getting those pieces in place. Like I said, there's a lot of resources out there. You know, maybe you've always wanted to do some videos for your business. Well, you're home, there's technology. Start some videos, build some videos that educate your consumers, and start a YouTube channel. We're going to have a couple webinars coming up in partnership with Main Street Amherst around creating a YouTube channel. So, you know, the biggest thing I hear from business owners is there's no time. Well, if your business is closed right now, you might have some time. So use it to look at ways that when things reopen, you're coming back with a vengeance, right?
Yes.
You know, and again, even though your physical location may be closed, you still can stay in touch with your clients. I mean, maybe you have an email list and you can send out some really great email content. Maybe if you haven't done a newsletter before, maybe it's a great time to start a newsletter and connect with those people that are interested in what you're doing, and let them know what your plans are for when you come back, you know. Or you know, look at some of those things that you've thought about doing and you just haven't had the time, you know, like subscription boxes. If anybody does like BarkBox or HelloFresh or any of those things where you get like a monthly box full of goods, maybe you've thought about doing a subscription box, and now maybe it's a great time to start. Maybe you're gonna start some kind of delivery service for your clients, you know. Like I think about a beauty salon, and like I still need my hairspray, and I'm a child of the 80s, so I need my hairspray, right? You know, and it's like I could order it off a major site to get it, but I'd much rather get it from a local salon, and even better if a salon could deliver it to me, you know. So I don't know. So just think, if you need help brainstorming, we're happy to help you with those things, but it's not, you can't take your foot off the gas in growing your business right now.
No, that's good feedback. And Dawn, I'm going to ask you to join in here. Dawn Calvert is leading our business services here at the City of Elyria, part of my team, and we're going to be working, as I mentioned, close with Sbdc. Dawn has already started to reach out to businesses in the City of Elyria to work with them. If you haven't received a call from us yet, and you're an Elyria business, please fill out that form on the cityofelyria.org's homepage, or call us, with Dawn's number there. But Dawn, why don't you introduce yourself and give us some of your thoughts on the conversation. Oh no, you're still muted. Let's see. You're unmuted on the screen, but we can't hear you. All right, so Dawn's getting her tech together.
Yeah, Frank, can I just say one thing too?
Yeah, please, please.
Just a couple words is I want to make sure that minority-owned businesses are really comfortable reaching out to us if they need assistance. And we do have a bilingual Spanish advisor available, and we have materials in Spanish if a client would need those materials. But, as it's part of our mission to really work with historically underserved populations. And I have seen, just anecdotally through our office, I would say a reduced number of applicants for this assistance. And so really getting the message out to all of the community is really important to me.
And I want to encourage every citizen in Elyria, if you even know a business person, tag them in this post, call them, let them know. I think so often we self-disqualify. We're like, well, that's not for me. That's for someone else. Those resources, that has nothing. And we miss out on these resources. And you should know your mayor was fighting that for language in this CARES Act. Like, we've been lobbying and trying to make sure that there was things in there that supported small businesses, supported cities our size. And so the fact that the resources are here, I need our residents to take advantage of this. Another quick commercial we didn't mention is just in terms of unemployment. If your business was shut down or closed or anything, there's a lot of unemployment benefits right now. The stimulus check is supposed to come in the next couple of weeks. If you're on unemployment, you'll get an additional $600, and then you'll be getting your unemployment check as well. So make sure if your business was closed that you go ahead and fill out this. And again, this link will be online. It's through the Ohio Jobs and Family Services. So you can go online and fill that out, go on the unemployment side of the site and fill out the unemployment application. As you've heard, that system is getting overwhelmed, but make sure you're getting in there. Don't let that stop you. It's going to take some persistence, but don't let that stop you.
Historically, some people have been disqualified due to maybe credit issues or lack of collateral, and those parameters have been expanded for some of this funding. There's no personal guarantee required on the Paycheck Protection Program, and they increased the amount up to $200,000 that there's no personal guarantee required on that. So even if historically you might think that you don't qualify, I'm still telling you to apply because of the expanded standards. Yeah. And like I said, it doesn't cost you anything to apply. So get in the queue. Worst case scenario, you don't get it, but you're certainly for sure not getting it if you don't apply. So so those are just things that we've seen that it err on the side of applying rather than not applying.
Yep. No, that's good advice. And we're chatting internally about those who aren't eligible, don't receive funding, but they still applied. How can we support them? So please do that no matter what, so that you can be in the queue, even for other initiatives. Just having your name on that you've applied is going to be important. So please do so.
And even if you're a solopreneur, so it's just you and your business, or an independent contractor, as an employer, I cannot include the money I pay to independent contractors in my average payroll, but those independent contractors can apply for the Paycheck Protection Program themselves. So you don't have to have employees necessarily to apply for the Paycheck Protection Program. Okay. So I just, again, I think like you said, some people self-disqualify right away, but these programs are very expanded from the normal programs.
Yep. that's an important piece right there. If you're a 1099 self-employed person, that you can apply for that program. Definitely, I know there's a lot of photographers out there, a lot of folks who are just doing their self-employment piece who probably look at this and say, I'm not eligible. Even the unemployment they're eligible for. And so make sure that you put your name in that queue and make sure you apply for these benefits. So we are going to open up the questions. I think Dawn has figured out her tech pieces. So hi, Dawn. I know we got at least audio with
Hello. Sorry about that. Yes, I figured out a portion of the tech piece. So I'm on the call, but unfortunately couldn't.
Now all you have to do now is click camera. That's all you have to do is click on your camera, and then you'll talk through the phone, and then we'll see you on the camera.
All right. Well, I just called in on the numbers. Do you want me to rejoin?
You can stay on the phone and just hit. Oh, you disconnect on that. Oh, you're fine. Okay. All right. So cool. So Dawn.
All right. Sorry about that.
No worries. Go ahead. Introduce yourself, and then if you want to eventually get your video back up, great. But go ahead and introduce yourself.
Yeah. Hi. So thank you for having me, Lisa. Thank you for sharing all that fantastic information. And Mayor, I think you asked some really great questions on behalf of the business community. I'm Dawn Calvert. I am with the City of Elyria as Director of Economic Transformation and Business Services. So your business means a lot to us, for all of those affected by this pandemic. And we really want to make sure we're supporting you and helping you through this time. So I believe my contact information was shared, and please feel free to reach out at any time. We can help filter through a lot of this information and get you connected with the right folks.
Awesome. Thank you, Dawn. Again, I'll pull up the website, our city website. Right here on the home page, you'll see Dawn's email address, her phone number, and then this form that you can complete that will tell us a little bit about your business, and then we'll be able to follow up with you and help you navigate and figure out the right resources for your business. So appreciate that. We are gonna open up the line to some questions, and then we actually, I'm hoping we get a special guest, an Elyria entrepreneur, to join in as well to kind of share how they're adapting to this as well. But Ren, have there been any questions? I know we had to start a new feed. Have there been any questions put on? Ren, I'm sorry. I don't think I said Ren's name. Ren, is there any questions that have been posted on the Facebook?
I'm having some tech slowness myself. Give me one moment.
No worries.
All right, we had a question come in, something about the form. So we just fixed that issue in the form if y'all are filling that out right now. But wondering if Dawn, if you can speak a little bit more to what someone could expect when they complete that form.
Dawn? I see she was connecting through something again. There we go. And Chris, we're going to cue you in a second. Thanks for joining us, Chris.
Not a problem.
Well, while you're here, oh, here goes Dawn. So Dawn, what can a business expect if they fill out that form online? And Dawn, you're killing me with the tech stuff right now. Your video's good, but your phone is muted or something. We're not getting any sound through your phone. Oh, it says connecting audio. All right, we should be able to hear you now once you unmute. All right, try now, Don. No. All right, Don, we'll have to let you know how the TV announcer's like, we'll have to come back to you in Cleveland. We're gonna go to you, Chris, in Elyria. So Chris is an entrepreneur who lives in Elyria. Business is based somewhere else. Hopefully someday it'll be in Elyria. But you know, we're talking right now how small businesses are adapting to these times right now. Lisa Hutson from the Small Business Development Center is on here, And as an entrepreneur, just kind of want to hear how you're approaching it, how you're looking at it, talk a little bit about your business, and yeah, give us some insights.
Sure. Thank you for having me on. I really appreciate it. Sorry if things get a little bit crazy. I am tethering from my phone right now because my internet is out thanks to that storm last night. So, yeah, it's been out all day. So hopefully we can get through this just fine. So, my name is Chris Schneider. I run a digital marketing agency. We are based in Rocky River, but hey, right now everyone's working remote. So technically we've got about 8 offices spread across the world right now. So, we're a pretty big deal if you're looking at it that way, right? And what I hope is that people can start to look at this with a little bit of a glass half full approach, right? This is an opportunity to actually start to innovate as a business. And I think people need to look at it that way. So what a lot of people don't realize is that Netflix started their streaming service in the Great Recession, right? So they added 13 million subscribers in 2009. They took and looked at their business and they said, how can we evolve to make it better right now? And so what we're seeing a lot of is a lot of people coming to us hoping to get an online store up, right? So restaurants that currently had to close down, if people wanted to still support them, there's a way that we can get an online store up really quickly. And they could sell digital gift cards online, or they could even put together a couple of products for like the daily special and offer online orders. So from a local standpoint, we're starting to see a lot of that. We're starting to see a lot of people put their efforts there. For those that have e-commerce businesses, we're starting to see them actually increase sales overall. Which is good. So, you know, what we've been telling a lot of our clients right now, if your marketing was working before, if it was giving you ROI before, then continue trying to push down that path. It's the same thing. A lot of times people want to be very reactionary, right? It's really hard right now. It's very difficult for a lot of businesses. But if you're able to, and you have the means to continue on your marketing path, if it's still giving you ROI, it's going to be really impactful. The big thing we just have been advising all of our clients is to just change your messaging. Tweak your messaging. Right now, if you're a business, being real, being authentic, and, you know, having empathy towards other people is big. So just don't get frustrated if you can't hit the sale right away, and you can just, you know, maybe it's more about building a relationship right now. And so a lot of the content that we've been putting out as an agency has been, how can people adapt right now? How can people, you know, figure out working from home? I have, you know, 3 kids. My wife works full time. It's hectic in our house right now, but we're just all figuring it out. And that's the big thing to remember, is everyone's figuring it out together.
Yeah, that's the beauty, is we all have an excuse to fail or do something wrong now. You know, it's like, go for it, because we're all trying to figure it out. And you brought up the point of relationship management. Again, Chris, thank you for joining us on short notice like this. But, you know, Lisa was hitting on that point as well. It was like, you know, this is a great opportunity right now, even if you're closed as a business, to still maintain communication with your clients. You know, my daughter's in a gymnastic program 10.0, and we're getting, like, they don't have classes, of course, but we're still getting communication. You know, they're hitting us up, hey, do this with your kid. Hey, we got this available virtually. So, like, that sort of loyalty they're building with us right now in the midst of this, like, that's gonna last now. You know what I mean? Like, we'll remember during these times who was looking out for us. And so if either you want to speak to kind of the brand loyalty, and again, from an authentic place though, you know what I mean? Not looking at it from you know, manipulation and try to snatch and grab while there's an opportunity, but having that genuine connection.
Yeah, I think, so we have a client in Columbus who does youth sports, right? So he puts on youth sports programs. So like you would partner with him from the city of Elyria, and his company would be the one organizing things like soccer and baseball and t-ball and stuff like that. He was obviously hit very hard by this because they can't have groups of kids together. So he kind of had some ideas, and we helped him organize these ideas, and he started to post daily Facebook videos on his Facebook and Instagram of just like activities you can do around the house with your kids. And they've been really well received by his audience. In fact, he's starting to build a little bit more of an audience because of it. So yeah, I think there's things that people can do right now that yeah, they might not give you, obviously they're not going to replace your business being open full time. But if you're able to build some of that brand equity up right now, then later on, when we're on the other side of this and things can open up, people are going to remember your brand and your business over some of the others, that were just quiet the whole time. So if you're able to still keep, build relationships, but keep empathy in mind. If you're able to still do those things right now, it's going to be huge for you. And we're seeing that with a lot of our clients.
Yeah, it's crazy how that kind of ties back to prior to this. We had a discussion on mental health, and one of the ways to cope and boost just some of the mental health challenges is like helping others. And it was like we were talking about how volunteering actually helps. Not only helps the individual, but helps boost you as well. And it's like the same with business. If you're out there helping your client and helping you, not only is it going to help that person out, but it's also long-term going to help your business out. Lisa had mentioned earlier, there was one of those paint and sip businesses where, people come together, sip their wine and paint. She said that the business is sending out kits and still encouraging people to do it. So it's like, if we can get people to kind of, you hate saying it, I hate saying it, think out the box, but think, think a little differently during these times, they can not only survive, but come out of this stronger. And so again, we want to make sure that any business in the city of Elyria, if you need help kind of fleshing through these ideas, if you need help trying to figure this stuff out, to call us, fill out the form on the website and we'll walk with you through this. But Dawn, I see Dawn is still working on the tech piece. So, Lisa, you want to share any closing thoughts? I'll pass it to Chris, and then Dawn, by that time, will be ready, and then we'll have her close up.
No, Chris, nice to see you. Chris has worked with the Sbdc as a great partner to us. So that's great. But really, reach out to us. You can email us directly at Lorain, Sbdc at loraincc.edu. Frank, you have our Facebook page up there. We have a lot of content on our Facebook page. We've interviewed a lot of experts. We have a lot of our webinars, and there's going to be more to come. There are a lot of resources. Take the time now to think beyond surviving the next 8 weeks, but really thriving beyond that. And we're here to help you. So whether it's navigate the stimulus resources or to think about those things that you can do now and going forward.
Thank you, Lisa. Appreciate you. Chris, you want to share any thoughts as an entrepreneur, some fellow advice to other entrepreneurs?
Yeah, I mean, take advantage of Lisa and the Sbdc. Don't just kind of skim over that. We've dealt a lot with her, and we've also put on, whether it's, things through Lorain County Chamber or whatever, we've had a lot of collaboration with her, and there's a big resource there that a lot of business owners don't take advantage of. But I would just say continue, like you said, a paint, wine and paint place that probably never offered kits to go before, all of a sudden is innovating a little bit, and they're still able to figure something out. And the beauty of that is when they come out of this, they can now have their regular business going, but all of a sudden they've created an extra revenue stream for them. And who knows, it might be more popular. I have 3 kids. It's difficult to get out of the house for a date night, but hey, a date night in sounds a lot of fun, right?
No doubt.
So just continue to think about, I know it's hard because there's a big mental hurdle of everything going on right now, but what we've been helping with or communicating with some of our clients that are completely shut down is they are, take this time to work on your processes, the stuff that's not real pretty, right? If you need to rearrange your showroom, or you've been putting off, doing 1, 2, and 3, or come up with come up with a new business plan, come up with a new marketing plan, get yourself set up so that when you come out of this, you can come out, you know, like a rocket ship instead of just kind of stumbling out of the gate. So yeah, continue pushing as much as you can. You can follow us on Facebook or Instagram at Duo Cleveland. That's DUO Cleveland, or duocleveland.com. We're trying to share as many resources as we can with people and as much helpful tips and advice as we can right now.
Awesome. Thank you again, Chris, for jumping in. And that's the beauty of this virtual piece is like, hey, can you pop in over here and say what's up? I appreciate you coming in and sharing some great insights. And I'm proud of all the work that you and your company are doing. And yeah, like I said, one day we'll have the beautiful, nice headquarters here in Elyria.
Sounds good. I think my team's all getting used to working remote, so I'm going to struggle to even get them back in the office.
I know people are realizing, I can do this from home. I don't need to be in there. But
Yep.
But
Excellent.
New normal. But again, thanks again.
Yep.
Appreciate you.
Thank you so much. Thank you.
And Dawn, are you ready now? Are you? All right. Yes, we can hear you.
I'm ready. Can you see me?
Yes, Dawn.
Oh,
thank you.
So,
if you could kind of give some closing thoughts again, and whatever you're speaking into, if you could get a little closer to it, and
all right, can you hear me now?
Reinforce how people can contact you, and again, what people can expect once they fill out that form.
Yes, thank you. So thanks for your patience, everyone, with the technology issues. I love what Chris was saying earlier about making mistakes and big learning curves, and I am evidence of that today. So thanks for bearing with me while we worked out the technology. So the form, fill out the form. It's quick, it's simple, it's easy. It will help us be prepared to give you some guidance back. You can always call me or email me. You can reach me on my cell at any time, and that's 440-281-0992. Or you can send me an email at dcalvert@cityofelyria.org. And we're here for you to answer any questions you might have. So even if we don't have the answer right away, which as we've talked a lot about today, we're all learning this together. Things are changing rapidly. Some things are not finalized yet, but we want to support you through this. We want to help take some of those obstacles away, take some of the pressure off, give you a little breathing room to be able to really focus on your business and how to get through this time. So we're more than happy to point you in the direction of the right resources. So please feel free to reach out at any time.
Awesome. Well, again, thank you, Lisa. Thank you, Dawn. And small businesses in the city of Elyria know that we got your back. We're in this with you. I want to give you a bit of relief, tell you to take a breather. Don't feel like the world is going to crumble. The same spirit you use to start your business, that same spirit will help you to recover through this. So don't feel like you have to scramble around. Take a breather, relax. We're going to get through this together. And then when you're ready, fill out that form, and we'll make sure we spend some time together and help you sort through these resources and in partnership with Lisa and Dawn as well. So again, thank you too. And we're going to shift to the last portion of this. And I'm not going to play any music or do any dancing because that's what messed up the last time. So we did have a question. Go ahead, Ren, you had a question come in. Maybe
for Lisa, Dawn.
Lisa, thank you. Perfect.
Yeah, we just have a question coming in from the Facebook. Yeah. Someone is asking if you can just kind of speak to so this comment, some of it is kind of they're kind of going into some narrative, but they're mostly getting at if you can speak to kind of price gorging after crises, and if you can speak to it on the business side, why someone might be raising their prices during the pandemic or afterwards, and then if you can maybe speak to it a little bit on the consumer side.
Yeah, so we're absolutely seeing this. People know this. This is classic economics with scarcity and demand. So there's large demand for a number of items that whether it be the personal protective equipment, hand sanitizer, cleaning products, toilet paper, we've all seen this. So anytime those materials become harder to get access to, the prices go up. And we are seeing that, people are seeing that. And as things are more challenging to get a hold of, a lot of times the larger companies have better supply chain, better access to get those things. So a great example, you might not be able to go into your local store and find hand sanitizer, but Walmart has the purchasing power to order tremendous amounts of those and probably pay a little bit more for that. So they're going to have access to it. So we are seeing that, we are hearing about it. And I have to be honest, I don't know that there's a great short-term solution aside from boosting production, which a lot of effort nationally and within the state is being made to encourage production of the products that are most in demand right now. And as that production increases, we should see the prices come down a little bit.
And then also locally, you see companies putting limitations on the amount that can be purchased, so that
Right.
you know that supply can be arbitrated, locally.
Right.
Lisa, any thoughts on that?
No, but I do think that there might be some price shifts and things when we get back to fully working and all businesses open, just because many things, right now gas prices are really low. So delivery costs might be a lot cheaper. So that might have a positive effect for the consumer. But other things, pieces that industry needs to build whatever their widget they're selling might go up. So, a company needs to really look and maybe reevaluate their cost of goods sold, and when they go back into the marketplace full speed ahead, and really be aware of what a price increase may do to consumers or may not. Like, I know right now I am really missing going to brunch with my friends, and if my favorite brunch places raise their prices, I would be okay with that, because I just want to have brunch with my friends. But other products may be a lot more price sensitive. So I think now, when I alluded to before, that businesses really need to look at their financials closely and understand that cost of goods sold and how things might change as they re-enter the marketplace. So again, understanding those numbers is really important for a whole lot of reasons.
That's awesome. That's awesome. Again, thank you, Lisa. And if you want more information on SBDC, you can go to the Facebook page, facebook.com/LC3SBDC, and get more information. Again, this presentation will be available to you after this town hall is over. But again, thank you, Dawn. Thank you, Lisa. And thank you to Chris for also chiming in as well. Thank you. All right, now we're gonna segue into some community updates. And so I already did I show you all the voting video yet? No, I didn't. All right, so I'm gonna show you this quick video. I hope that we don't get the same issue before with the video stuff, but I'm gonna show you this video because it's so important that we vote. We know that LCCC, my alma mater, has an issue on the ballot and that voting in person was canceled on March 17th, but now you can vote via mail. And so this video is from the Secretary of State office, Frank LaRosa's office, and it's going to show you the process of voting in this extended primary. So take a look at this video. Oops, sorry. Thought I was going to take a look at this video. All right, how do I do this? All right, Ren, how do I do it? Hold shift or something? See, I'm supposed to be the techie. All right, copy REL loop video. There we go. And it's just music playing, there's no words. So print your own. You can call the Secretary of State's office and have it sent to you, or you can make your own. You mail in the request for your ballot. Wait for it to arrive, fill it out, sign it. So that's a video from the state, and here's our local Lorain County Board of Elections website. I'm gonna pull that up real quick. Where you can, again, you can print your absentee form. It tells you what date to put on that form. If you don't have access to a printer, you can write one up at home, follow these steps. Again, you can, there's an address to mail that into. And as you saw through the Secretary of State's office, you can also call their office and request. I would recommend calling the Board of Elections. This election is too critical for us not to vote. We understand that this is critical times in life, threatening times, but we need to make sure we still vote. Our community college is too important to us. And there's different candidates that we need to be voting on as well. So make sure you vote. Here's the phone number to the Board of Elections, 440-326-5900. So be sure to call them, go on the Secretary of State's office, print out an absentee ballot request form, mail that in, and make sure your vote is counted this year in 2020 in this primary. So that's one of the updates I had. The other updates I wanted to share is that we recently as a city got some CDBG funding, which is Community Development Block Grant. This is the funding that traditionally goes to communities that we use to help serve. And so organizations like the Urban League, when I was there, we used this funding to help people with job search and help people find jobs. Salvation Army uses these resources from the city to help people with utilities. Save Our Children use this for summer camps for young people. Boys and Girls Club, there's food programs. There's a lot of things that these is going to be used for. So I'm going to be asking you all to help my office not only identify those needs in the community, but also identify those community partners to help us meet those needs. And it's going to be a quick turnaround. So I need you to stay in tune with this. Continue to follow us on Facebook. Continue to follow and stay in tune on the website, thecityofelyria.org. We'll do our best to get the word out via newspaper, via social media, and to make sure you're in the loop on that to help us identify these needs and these partners to help us do this, to help us meet those needs. Secondly, is around the census. So the census, again, we still need you to make sure you fill out the census. There's resources online to still fill out your census if you weren't able to yet. The reason we're getting these community development block grant dollars for our city is because we have somewhat of an accurate count of the number of citizens in our city. Because we have a city of more than 50,000 residents, we directly receive our community development block grant money. So let's say this year we don't complete in the census, we could potentially lose that community development block grant money that is being used to feed seniors, to make sure young people are being taken care of, that are helping people with their utility bills, that are helping people find employment. And I'm sure you know someone personally that's affected by those services or is in need of those services. So how can you help? Is by filling out your census. So if you go on 2020census.gov, you can still continue to respond to the census. And so we want you to be counted. I'm gonna ask, you'll have access to this presentation afterwards, but we'll make sure there's a link to the census as well in that in this presentation. Next, I wanted to invite a council member Marcus Madison, who's gonna join us and talk to us a little bit about updates in his ward, as well as share some updates from city council perspective. So Councilman Madison, thank you for joining in. And Ren, if you could get Councilman Madison's video and audio ready. Thank you. Yes, good to see you, Councilman.
It's good to be seen.
Yes. So yeah, so the floor is yours. Why don't you give us some updates on not only what's going on in your ward, but also what's going on with City Council. We had our first City Council meeting virtually on Monday. That went very well. And you're not downtown right now, just so this is a background. So it's not just hanging out downtown. But yeah, go ahead, give us an update on the ward and City Council.
Absolutely. First, I want to say thank you and kudos to your team, the Safety Service Department, and the work that you guys have been doing to engage the residents, engage city council members, but also even after the storm, just being able to get the information out and let people know that you guys are working hard. So I'm excited to work with you all, and I look forward to the work that's ahead of us. And as you mentioned, City Council, our first time going virtual, it was great. And we thank the IT and the department for helping us engage this way. As it relates to the ward, we're still moving forward and trying to figure out new ways of engaging people. So I thank you, because I'm also inspired now to figure out how I can even use this technology to engage some of the residents here. We're still seeing the projects move forward with the new Hamilton School. Also, the library has been a great resource, even though we've been closed during this time period. But it's been great to see students and families use that as a resource as well. The Second Harvest Pantry was great to see so many cars come through the neighborhood to seek those services. So we're excited with that. I really just want to be here to let people know that your city council members are still here. We're ready to work, and we're here to answer any questions in addition to the administration. If you need to reach your local council member, you can visit the website, Elyria City website, and click on the elected official tab, and that will give you the directory of all of the city council members. Oh, here we go. Yep, city council. You'll be able to see any of your council members. Contact us. We're here, we're working, we want to engage, we want to be a resource for you. So if there's anything that's happening in the neighborhood, or if you have any concerns, give us a call. My number is also there for the residents of the 5th Ward. That number is 440-201-9673. And also, I just want to share again, you mentioned the CBG funds. That's a great resource. If residents in the neighborhood are experiencing any issues, get connected, use those resources, reach out and figure out what that looks like.
Division 2. Thank you. Hey, little Kiki.
She lives down the street from me, so we're neighbors.
Nice, nice.
And the other piece is supporting nonprofits. If you're in a position to think about some of the nonprofits in the community that's still operating and meeting a need, Save Our Children, Boys and Girls Club, Our Family, these are all great organizations here in the 5th Ward that's doing great work. So keep those in mind. Later today, City Council will be convening our Utilities Committee. We're going to be talking streets, so we encourage you to tune in to that as well, and to also follow all of our virtual meetings online as well. So that's all I've got, Mayor. I want to thank you again for giving me the chance to join you for today's call. Yeah. I missed the dance party, so I'll have to
nice. Yeah, I know they shut it down. Facebook shut it down. But if you want to hang out for a minute, Derek Firestein. Derek, are you still there? I'd like to give some updates from the city standpoint of just operations for the city and how we're keeping things rolling here. So you got the falls behind you. You got the downtown behind you. I'll just wrapping out. I like it. Go ahead, Derek. If you give some updates about just City Hall and city operations, that'd be great.
Obviously, well, thanks, Mayor, for conducting this. That way we have an opportunity to reach out to the citizens of Elyria and try to provide some updates. Obviously, last night we had a big storm kind of hit our area, and we're working on responding to that, cleaning up. Sanitation has been great. Forestry has been great. Street crews have been great. Fire and police helping respond to those calls, trying to get cleaned up. First Energy, for those of you out there that are experiencing power outages, if you go to outages.firstenergycorp.com, you can see a map and they give updates in all the area. Most of the power should be restored today. There'll be some areas kind of near Lake Avenue, kind of the northern part of the city that may be out until tomorrow, unfortunately. They have crews in from Sandusky. They are reappropriating crews from Sandusky to help with Elyria, obviously because the whole region got hit. So their crews, especially with COVID-19, it's greatly impacted their services, but they are working tirelessly. I received an update from their regional rep on that, and I have him on my speed dial for today to making sure that we get any and all updates that we need for the city of Elyria. Overall operations for the city, we are still trying to manage the best we can with the current situation. We have, luckily for water, wastewater, we plan for these type of situations. That way we can continue operations for water and wastewater operations for the residents. EPA requires us to make plans in case there's tornadoes or earthquakes or large thunderstorms or anything like that, and even pandemics, to where they could just basically flip the switch. The crews have all been instructed on how to operate, and we are doing our best to make sure we can preserve our workforce through this, whether it ends this month or whether it ends next month. Our job is to make sure that water, wastewater operations continue, because those are probably two of the very more important items that the residents need in order to combat this pandemic. On that sanitation, they've been doing an amazing job as of as they always do, but especially during light of this, they're out there taking away the stuff. And as the mayor indicated, they're people are home, they're doing those projects that they just never had the time to do, and now they're putting more out there. So please, if you could, when you put bulk items out there, or you're putting more out there, make sure that it's neatly packed together, making sure it's not scattered about, just to maybe make their jobs just a little bit easier. That way they can continue to respond to the residents and continue to do the great service that they do for our residents. That would be a tremendous help, and I know they would greatly appreciate it. So if you're looking for how to show your appreciation for what they do, if you can make their job just a little bit easier, it's going to go a long way for that. Police department, fire department are operating as they normally have. They've instituted some social distancing practices to make sure that if someone was to possibly come down with symptoms, it doesn't spread throughout the department, because we can't lose our safety responders during this. And as well as the weather starts to turn, we're going to get our crews out there. There's going to be grass that needs to be cut. The warm weather obviously is going to bring out some different activities. So we are operating as we always have been in the city, slightly modified, of course, but trying to provide the best service we can to the residents of Elyria. And obviously it's a challenging time, and people have a lot of questions, but we're going to do everything we can to continue our efforts and provide the best service we can. And I'd be happy to try to answer any questions that any of you may have out there.
So yeah, we wanted to open it up for the residents to ask any questions that you have of myself and our administration, maybe city council, and then and then the city services. And so, Ren, instead of reading these off, I'm just going to cue you in to ask some of the questions that you're seeing. And please, right now is a great time to ask these questions that others may have, because this will be shared later on and people can get answers to their questions. So, Ren, if you want to answer. And again, we ask you to just keep the questions meaningful, respectful comments and all that good stuff as well. I understand that, Facebook is a lot easier to troll on Facebook than other mediums. So I get that as well, but we just want to get some meaningful discussion here with our residents. So, Ren?
Mayor and Director, can you speak a little bit to what we as a city are doing to kind of implement safe distancing practices at our parks? We've had some people call in and ask about the basketball hoops being taken down, but then people kind of getting unique in the way they're engaging in parks and maybe crowding tennis courts or other things. What are we doing to kind of combat that, and what advice and feedback would you give to people that might still be doing that?
Yeah, so again, we're encouraging everyone to, as much as you can, stay home. But we understand, if you're a family of 5 and you go to the park together to play tennis, it may look strange. It may look like, hey, there's a group gathering there, and why are they gathering? Where they're a family, they can do that. That is fine. But when we heard complaints about groups of kids playing basketball, and trust me, it's one of my biggest concerns to have all this teenage energy in the city and not having it directed somewhere. I made the call and said, hey, I don't want police being called on kids and conflict happening between kids and cops over basketball. Just take the rims down. So I instructed Parks and Rec to take the rims down. They took all the rims down. And, when we get out of this, we'll put them back up so that we can have those games again. But we're just trying to encourage people to stay home as much as possible, but we understand that people want to exercise. Now, in terms of the tennis court and things like that, again, we're hoping that these are families playing out there, that this is people within your home, so that you're not spreading. But again, I just hope that people are taking this serious. As was mentioned earlier, we had our first fatality in the city of Elyria this past weekend. And we're expecting a surge in cases and unfortunately in fatalities as well. So we're just asking people as much as you can, do this, be a hero, be a hero and stay home and try not and just resist for the next 4 weeks. I'm just asking you to resist the temptation to just go on as normal, but try to, stay at, if you're going for a walk, great, but the gathering and congregating in the parks with random people that you may get that sickness from somebody who's asymptomatic, you go visit your, someone at home who has asthma or has a breathing issue or a health issue, or someone's grandmother at the grocery store or whatever, and you're carrying this virus around all for the sake of, I wanted to hang out with my friends at the park, I'm asking you to step up, and be a hero to the city and help serve this city in that capacity. But I don't know if either of the two of you want to chime in on that.
Yeah, I want to say again, thank you to the administration. I know that we had a couple of teens that were out playing basketball at one of the nonprofit organizations here. We've been able to work with the administration and work with some of the residents around that work. And I think you're right. I mean, this is just going to be some time for folks to just get out and enjoy the neighborhood, take a walk in your own neighborhood, see what's around. I know we've been doing a lot of yard work around the house, provided with the bags from the city. That's been helpful. So we've been just working on beautifying our own little part of the neighborhood here. So encourage people to take that energy and try to do that in your own neighborhood.
And if you need bags, let us know. I think I heard Kevin the other day taking some bags, Kevin Brubaker. And shout out to Kevin Brubaker. This morning at 1 o'clock in the morning, when all those trees were all around the ground and stuff, Kevin was out with the forestry team and cleaning up the streets. And just want to give a shout out to Kevin Brubaker, working with the fire department all throughout the night. So again, these city employees, I think this is a chance for us also to appreciate, people often are like, taxes, why do we pay taxes, et cetera. And now you're seeing, without it, we just continue to see branches in the street. Without it, your trash would be piling up in front of your house. Mm-hmm. So I think you get a chance to kind of see your tax dollars at work. And I'm proud to be a part of a team of folks who are working this hard with this much compassion. So, Derek, anything you want to add to that?
No, I think both of you covered it very well, and we're just going to keep doing our best. And, as the police are out on their patrols and they see people, they're not going to do anything strong, but they're going to recommend that they break it up, because again, the more we spread it, the longer we're going to be in this situation. Yeah. So the faster we can flatten that curve, the faster we can get back to hopefully more of a normal life. But no, I think you both covered it very well, and thank you.
That's so true. If we flatten this curve, if we can all buy in to staying at home in this next 4 weeks. I just read an article about another country where they all just bought in. And they bought into it, stayed in, and then it flattened completely, and they were able to go back to a sense of normalcy. And it's like, if we could all just buy in to this, we can get through this faster. But let's go to more questions. Ren, what else you got?
Can you speak a little bit to how the We Care Elyria partnership was formed and how that fund is managed?
Yeah, so the We Care initiative was formed when I heard that there was food being delivered or food being provided for kids and families. But at the same time, I heard a simultaneous message of encouraging seniors to stay home. And I saw that there was a gap. So I've reached out to people I've worked with in the past in the faith community and said, hey, there's this need that's arising in the community. Can you step up and handle this? And, they met, had a phone conversation, yep, we'll do it. Church of the Open Door said, yep, we'll create a fund. We'll manage the fund. We'll make sure that supplies are purchased. And I said, all right, as a city, we'll help store. We're already getting the calls. We'll take the calls, put them into a system that you all can see. And whoever wants to be involved can be involved. It hasn't just been churches. Churches were the folks I initially reached out to, just due to my network, but all kind of folks have been getting involved that aren't a part of any church and could care less about a church, but are still involved because they care about people. And so I think that's our common thread is, the folks involved don't want to see our seniors get left behind in the midst of this social isolation, in the midst of this, them being more vulnerable and at risk, we don't, a group of people don't want to see them fall victim to that. So, and we also want to protect them so they don't have to go outside of the house for basic needs. So we're looking for volunteers. If you want to sign up to volunteer, you go to LearyCares.com and sign up. And if you know a senior or someone with a disability or some, you can fill out the form on LearyCares.com and help them get access to the services.
Can you speak a little bit to what a kind of successful or maybe a community-driven rise out of this pandemic might look like to you, what you're envisioning for after when kind of the dust settles from all of this?
Yeah. So that's a great question. So I think out of this, the reason I keep saying that we can be stronger out of this is, I said it from the beginning, even during the campaign and being elected. I think that if we want to go far, we have to go together, and that we have to be willing to collaborate and communicate. And I think this is almost forcing us to have all of us have to buy into this. If half of us buy into it, we don't move forward. It needs to be the city working together, buying into staying at home and social distancing. If we don't buy into it together, the virus still spreads. And so I think out of this, we'll appreciate our community more. I think that we'll be more collaborative and willing to work together. Relationships will be formed. As I mentioned, some of these seniors who've reached out about food and have had some fear about this, they've been very candid. Like, their family doesn't live in Elyria, doesn't live in the state. So they've been alone. It's not like this virus made them alone. They've been alone for years. And so now they're forming connections with the rest of the city, forming connections with the rest of their community, which should have lasting impact. Once this is over, it's not like people aren't going to remember, Joanne lives on 8th Street and I know that she's there by herself. And so I'm going to make sure I continue to communicate with her and make sure she's okay. Like, that's going to last. Again, you heard from the small business side of some of the innovation that may come out of this from a small business standpoint, where some of the businesses are going to continue to do some of the things they learned during this time. And overall, I just think that tough times bring out the best of you, and that's my personal opinion. Through my personal journey is, there's been a lot of things I've had to overcome, but every time I've overcome, it's made me stronger. And I think Elyria has a lot to overcome prior to this virus. And I think this is just another thing that we're going to rise above and overcome. And out of it, we're just going to be 10 times stronger as a city and as individuals. So that'll be my thoughts. Anybody else want to add, or we want to go to the next question? Is that a mic drop moment? No. What's the next question? Any other questions, Ren?
Can you speak a little bit to the new process for voting and the kind of absentee ballot form?
Yeah, so again, this came out when the state recently signed their bill that allowed us to do virtual meetings, etc. So this thing is ever changing, or it's not, it has ever changed. We didn't know we weren't going to be able to vote until the night before voting that we couldn't go. So people still showed up at the polls on March 17th. So I definitely encourage you all to, if you want to vote and you haven't voted, I'm going to pull up their site again. Go to LorainCountyElections.us or call the Board of Elections, 440-326-5900, and tell them you want to vote, that you didn't get to vote and you want to vote. And it's their job to make sure you get the information and resources you need to vote. And you should pressure them to do what they need to do. And I know folks who work over there, they're a great team of folks. They'll be very helpful and responsive to you. But don't miss the opportunity to vote. Call 440-326-5900 and let them know that you weren't able to vote in the primary and you want to vote in the primary, and they'll walk you through that process.
Additionally, I think a lot of voters will be receiving, if they haven't already received it, they'll get a little postcard in the mail from Secretary LaRose with that kind of information on it. So if you are a registered voter, even if you've already voted absentee, you'll still get one of those. So if you've already voted absentee, you can disregard. You've already done your part in voting. But if you've not voted yet, please utilize that absentee voting system, either on the county Board of Elections website that the mayor has up right now, or on that postcard that you receive, and make sure your voice gets heard through voting.
Again, because LCC issue 17, we need a strong LCC, especially as we think about as we rebuild from this. We're going to need a strong community college system in this community to get us up out of this and embark us on this new journey. So thank you. Any other questions, Ren?
This is someone asking about this video, just wanting to make sure that it's going to be available online, and I've shared that it is. But maybe if you can speak a little bit to your goals in doing town halls like this.
Yeah. So, so yes, this video will be available online. What we'll probably do is cut it up in segments, from the mental health segment to the small business segment to the community segment to the segment with Dave, and then we'll have it available for you can just watch the whole thing. Because I think some people want to watch specific aspects of it, and we don't want you to have to kind of sort through that. But this will be available on our YouTube channel, as the city's YouTube channel. I'll make sure to share this out on my Facebook. We'll make sure this is available on the city webpage. You know, and our intent of doing this is to keep you engaged and informed, to give you access to me. You can always call me. You know, my cell phone number is 440-723-8555. You know, it's on my business card if you got it, but 440-723-8555. You can always just call me, but this is another way to access and ask questions publicly. And so we'll continue to do this. And then I want to hear back from you all. Part of it is like, you know, being in this bubble, in this, you know, working every day, trying to make sure the city's running and working with small businesses. And now with this stay-at-home order, I don't get a chance to kind of just walk around in groups and meet folks. So I also just want to hear from the citizens, like, what are y'all feeling out there? What are your ideas? What are your thoughts? What's concerning you? So that I can be responsive to that as well. So you can always email me, you can call me, but we want to do this to keep you engaged and informed. And yeah, I hope you take advantage of it. I hope you share it with others in your network. Don't just take it for yourself, but share it with others. And, you know, we got a lot of compliments. You know, we did our planning commission meeting yesterday, and we got a lot of compliments from the businesses, just giving kudos to our city for keeping things rolling and finding ways to keep things going and using technology to keep things going. And so, again, I think these are some practices that we should consider continuing even after this, of ways to keep you engaged and informed. So I'm appreciative to all of you. Thank you to Councilman Madison. Thank you, Derek, for sitting through all of this. And thank you to Ren Flanders, my chief of staff, for behind the scenes DJing all this and putting all this together. Thank you to all the city employees who work so hard every day, police, fire, sanitation, street, everybody who's out there, all the nurses and doctors that are out there, all the mental health clinicians, all the families out there that are staying at home and really respecting this order. You're the real heroes as well. And I truly believe together we will get through this. We'll be stronger. We'll be better. And, you know, just know you have a mayor and a team that's committed to serving you all, to protecting you all, and to do our best. And, you know, we're going to work as hard as we can and try to keep us. And this is like, tomorrow is day 100 of the 100 days, the first 100 days. So I did not expect to be here doing this on day 100, but I wouldn't want it any other way. I'm appreciative of the opportunity to lead the city and to be a part of a team of folks that are helping to serve it. So thank you all. God bless you. And be sure to share this video with others. Take care.
Thanks.
Thank you.